A call-in line has been established for the community to hear the meeting interpreted live in Spanish. The number to call is 508-924-5155. Board Member LaSalle Frazier, please announce in Spanish.
Buenas tardes. Se ha establecido una línea telefónica para que la comunidad pueda llamar y tenga acceso a interpretación en español en vivo. El número a llamar es el 508-924-5155. Repito, el número a llamar es el 508-924-5155.
Thank you. Also, we're pleased to announce starting tonight that American Sign Language interpretation is now available. For those who are not able to observe now, the meeting is being recorded and can be accessed on the Prince George's County YouTube channel for later viewing. Lastly, for recording purposes, I would like to remind all board members, turn on your microphones when speaking. Board Prayer and Pledge of Allegiance. Vice Chair Walker, would you please lead us in the Board Prayer and Pledge of Allegiance?
O God, we pray to administer that which is just in all educational policies, being ever mindful of your guidance. Steer us to action with love, wisdom, and understanding. Amen. Let's stand for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Ms. Lopez, please call the roll.
Mrs. Adam Stafford. Ms. Buser Strother.
Present.
Mr. Briggs.
Present.
Dr. Harris. Mr. Jackson. Mrs. LaSalle Frazier.
Present.
Dr. Juanita Miller. Dr. Zipporah Miller. Mr. Murray. Mrs. Rout.
Present.
Ms. Walker.
Present.
Ms. Rivera Forbes. Mrs. Mickens Murray.
Present.
Dr. Harris.
Present.
Thank you. We have 9 members present. It is a quorum. The question is on the adoption of the April 11, 2024 Prince George's County Board Work Session agenda.
Second.
It has been moved and properly seconded. Is there any discussion? Ms. Lopez, please take a roll call vote.
Mrs. Adam Stafford. Ms. Buser Strother.
Aye.
Mr. Briggs.
Aye.
Dr. Harris.
Aye.
Mrs. LaSalle Frazier.
Aye.
Dr. Juanita Miller.
Aye.
Ms. Rout.
Aye.
Ms. Walker.
Aye.
Mrs. Mickens Murray.
Aye. 9 votes in the affirmative, none in the negative. The April 11, 2024 Prince George's County Board of Education Work Session agenda is adopted. There are no registered speakers for the public comments on agenda items for tonight. 3.1, Special Education Presentation. The Chair recognizes Superintendent House to introduce his team for the Special Education Presentation.
Thank you, Madam Chair and members of the board. I'd like to invite our Chief Academic Officer, Dr. Judith White, to the microphone, and Dr. White does have some of her direct reports that will be reported on special education this evening. Dr. White?
Good evening, everyone. With me tonight, I have it's okay for today, Trinell Bowman, our Associate Superintendent of Special Education. Many of you have probably already engaged with Trinell, and so she's going to share just an update on where we are, the different programs that we service, what the work looks like in our district, how we engage with our students, our parents. She's going to even share some data. She's going to talk about some of the auditing opportunities that we have with MSDE. And then afterwards, we invite questions so that we can have a dialogue about what's presented. So with that, I turn it over to Trinell Bowman, Associate Superintendent.
Good evening, everyone. Thank you, Dr. White and Superintendent House, for that introduction. I'm going to walk you through our session outcomes. I know all of you have the PowerPoint and the supplementary handouts. We're going to review our special education demographics so you have an idea of where we are as a district. We're going to provide some highlights on how the Department of Special Education supports specially designed instruction for our students. We're going to provide you an update on where we are with our special ed strategic plan, provide you with our monitoring results as we monitor the implementation of our IEPs, and then we're going to provide you with information around our approach to professional learning and training. So when we look at who do we serve, this data is as of October 1st, 2023. We served 16,438 students across our district. We have broken down this data set between our birth to age 5 students, our elementary students in grades K through 5, our middle school students, and our high school students. The largest population that we currently serve are students in our elementary schools with about 6,500. I also provided you with a program location handout that was a supplemental document as part of the presentation. And this handout just breaks down where all of our programs are, from our early childhood programs to our autism programs, deaf and hard of hearing, et cetera, throughout our district and those schools in which those programs are assigned, so that you would have that information. This particular slide gives you our disability categories for ages 3 through 21 for students who are served under an individualized education program or IEP. Our largest population are students with specific learning disabilities, and those students are typically impacted in the area of reading and mathematics. That's about 35% of our special ed population. Our next highest is students with autism. That is a fast-growing population for us in Prince George's County. About 5 years ago, we were at 14%. The data as of October 1st, 2023 has us at 20% as a district. Our next highest category are students who are developmental delayed, and we can carry that particular disability category up to the age of 8. So from age 3 to age 8. At age 8, IEP teams must consider one of the other disability categories. And then our fourth highest population of students with disabilities is students who have other health impairments at 12%. I did provide you with a chart just so that you can see the various disability categories and then how they break down in terms of the number of students that are in each of those categories. This particular slide provides you with our least restrictive environment. So the federal regulations does require that our IEP teams determine where a child's IEP can be implemented and what they call the least restrictive environment. In Prince George's County, the majority of our students are in the general ed environment at 73%. When I returned to the district in 2016, 49% of our students were served in the general ed environment. So as a district, we have made tremendous progress. We know what the research shows. It shows that when students with disabilities are educated in general education classrooms next to their non-disabled peers, they have better academic outcomes. So we are happy of that data point improving so significantly. But again, you can see where other students are served as of October 1st for our district. This slide provides you with our least restrictive environmental settings for infants and toddlers and preschool students. Our infants and toddlers, we provide services either in child care centers or in a child's home. And then for our preschool population, again, you can see that we have the majority of our students attending an early childhood program and being educated, again, with non-disabled peers. So we provided you with the range of our LRE settings for our infants and toddlers and preschool students. Now we would like to give you an update on our strategic plan. We built our 1.0, our first version of our strategic plan was done for 2019 through 2023. There were 3 primary goals that we looked at for our strategic plan, and as a handout, you do have the 2019-2023 plan for your reference, but we focused on 3 goals, which was to enhance the delivery of special ed services, implement an integrated general supervision monitoring process, which at the time in our district, we did not have one, and then to really beef up how we looked at professional learning opportunities and coaching for both our teachers and support staff, as well as administrators, to really build capacity on how we implement specially designed instruction, and then from the building principles lens, how we actually monitor that. And so if we look at just a reflection of the objectives that we looked at as part of our strategic plan 19 to 2023, our objective one under goal one was to reduce the number of students who are enrolled in non-public programs. We know that we have to have a continuum of services, but we had a significant number of students that were in non-public programs, and when we looked at our data, the data really showed us that we had issues with providing appropriate services, and sometimes we had to result on students being placed in non-public programs. We believe that those students could be best served in our public school continuum, and so we worked very diligently to rethink our services. And so we did reduce the number of students enrolled in our non-public programs by 4%. You're going to hear a progress data point that we actually were able to reduce that number upwards of about 20%. Again, we still know that we have to have a continuum, but we have definitely improved and rethought how we provide services. Under Goal 2, by August 30 of 2020, the special ed department needed to develop a general supervision monitoring plan. We did meet that objective. The other objective was to look at providing a yearly report card to schools that really looked at performance and compliance data. We implemented that through our pilot schools, and that was met as part of this objective. And then objective 3, when we looked at the monitoring of our IEPs, we wanted those IEPs that were monitored to meet 80% of targeted indicators, and we also met that goal overall. For Goal 3, as far as our professional learning and coaching plan, by October 1st, 2023, we wanted to be able to provide that our data from our state assessments would improve in reading by 2 percentage points. We were unable to really qualify that particular data point because, as you know, we moved from the PARC assessments to MCAP. So that data point was unable to be measured, although the action steps that built up to that objective, you'll see as part of the progress, were met. For Objective 2, by August 2020, the department will develop a multi-year professional learning plan to support effective instruction and evidence-based practices and specially designed instruction. So we did meet that overall target. What you have as another supplementary handout is our final strategic plan update for the 2019-2023 in terms of the outcomes. When you look at the action steps that are included in the supplemental document, if you see a check mark, that meant that that action step is completed. If you see kind of this progress circle bar, that means that we feel that although we have met the target, we feel like we need to continue that for our strategic plan 2.0. One example that I can give is that we as a department still feel that there's more work to be done around rethinking our service delivery models, and so you'll see that as something that we're continuing with our 2.0 version. And again, you have that strategic plan final progress update so that you can see all of the specific action steps that were completed, what's continuing, and what was met. Our development timeline kicked off in June of 2023, where we met with our Strategic Planning and Resource Management Office and reviewed and spent a day with them, digging deep into not only our special ed data, but just looking at our data across our district as part of our Prince George's County strategic plan. So we looked at climate survey data that really focused on thinking about how teachers feel about the support they get, how parents feel, how students feel, any of those climate survey questions that really centered around special ed. We did a deep dive of that. We looked at our performance data on our state assessments, our benchmarks, as well as other performance and compliance indicators that the state measures us on. And then in September through October and December, we worked with our leadership team and other stakeholders to really look at our data and determine what are those action steps and objectives that we need to look at to measure. From January through February, again, we looked at our district data and met with the testing office and other entities to really make sure that the marks that we have are the correct target. Right now, what's happening is that Hanover Research is meeting with parents. We're having parent-focused meetings to look at the draft strategic plan, to get their feedback, making sure that parents have a voice in those action steps that we're developing, those objectives, seeing themselves in the plan. And so they're actually conducting interviews with our parents this month. They will then provide us with a final report at the end of this month. We would take that data, look at it, and tweak the strategic plan based on that input. And then our goal is to release the strategic plan between the May-June timeframe, of course, after we have our chief and executive team's approval. When we think about supporting students with disabilities, we really look at it through the lens of specially designed instruction. And so when we think about specially designed instruction, the way that the Individuals with Disability Education Act, or IDEA, defines that is we have to think of it as thinking about the content that are presented to students, the method in which we present that content, or the delivery of instruction. So really thinking through the lens of SDI through those three areas. We're really looking at the individualized needs of students with disabilities. So it's not a one-size-fits-all approach. You have to look at SDI through an individual decision-making process through that IEP team. We also look for the unique needs of students, and of course, we provide those supports and services to students and families at no cost, right? Free and appropriate public education is what we provide. Our goal is to make sure that we're giving students the access to the general education curriculum that may come through related services, support services, accommodations, etc. The way that we look at our approach in Prince George's County for supporting students with specially designed instruction is really through 5 areas that we have indicated on this particular slide. The first piece that we look at is our curriculum resources, and we have worked very closely with our curriculum and instruction partners in the 4 content areas of mathematics, reading and English, science, and social studies to have an instructional planning considerations document. We developed that about 4 years ago, and we make sure that we look at it and make tweaks to it. Our expectation is doing a collaborative planning block that special educators and general educators are meeting together in teams to discuss the students that are in their class so that we can make sure that we're beginning with the end in mind, that we're planning for those accommodations, those supplementary aids and services that students may need in the classroom. So this is something that is also highlighted in our collaborative planning document. Is highlighted in our curriculum resources to make sure that they're planning. The other area that we look at is really intentional collaboration. Again, with our Department of Special Education, our Curriculum and Instruction Office, that we are planning intentionally as it relates to rollout of curriculum instruction when we meet with our teachers, support staff. This year, we had a focus on specially designed instruction for principals and assistant principals as it related to elevating and monitoring specially designed instruction. We kicked that off last summer at the Summer Institute for our principals and assistant principals, and then throughout this school year at their systemic principal and assistant principal meetings, we've been going deeper as it relates to specially designed instruction and what their role is of monitoring that in their buildings and giving them tools that they can use to go back. The other area that we look at is our professional learning, and we use a blended model that you'll hear a little bit about in just a moment. For number 4 is our high-level practices. One thing that's great about special ed is that we don't have to figure things out. So the Cedar Center in the Office of Special Education Programs came up with what they call high-level practices based on years and years of research. So there are 22 high-level practices that we look at. The 2 that we're focusing on is explicit instruction and scaffolding support for our students. And then number 5 is our specially designed fidelity tool, which is a tool that we use when we go in to coach teachers. This is not to be part of their evaluation process, but really meant to build their capacity as we work with them to see how they're making improvements. Our SDI tool is divided up into 3 categories when we look at the co-planning, co-implementation, and co-monitoring. So we look at them through the lens of how do we plan for success. So we may observe them during an IEP meeting. We look at progress reports. We also look at the students during instruction for those key indicators as part of that SDI tool. Special ed interventions, we are still heavily involved with helping and supporting our school teams with the selection of interventions for students with disabilities. There is a yearly memo that is released from Dr. White that gives information around interventions that we use in our district, and there is a section for students with disabilities. We have what we call an intervention selection process document that school teams, upon the end of the year and closeout, they do enter data that they're using and recommend the intervention that the IEP team has recommended that is used for a student. And then over the summer, our team looks at that data to determine if the alignment of the present levels and the different data that we're seeing aligns to the intervention. We are still seeing, and this is why we're still heavily involved, we're still seeing some disconnect between the present levels of performance and an area of need versus what the intervention is doing. So we may see that a student has a significant impact in the area of phonemic awareness or phonics, but the intervention that they selected is for comprehension. And so we're still giving that feedback to the schools. Once school starts, of course, we cannot overturn an IEP team decision, but we do give that data back, and we do recommend that they reconvene to look at other interventions based on that area of need. And then for those schools that we see the misalignment, we do provide follow-up coaching and training for those school teams around that decision-making process. We also monitor the interventions. We have fidelity checklists that we use. We use a tiered system of support model where some schools actually get on-site coaching to help them understand the analysis of student data and how to make informed decisions. We also do desk monitoring biweekly, and then communication to all schools who have low usage. And that's something else that may also come on the accountability checklist and meeting with principals when we see low usage. Supporting our school-based staff through professional learning experiences. The way that we look at this approach in special education is through 5 areas: support, develop, collaborate, manage, and facilitate. And I'm going to walk you through each of those specific areas. When we think about support, it's very important in special ed that we build the capacity of that leader in the building who serves as the expert for special education. And so we look at our special education chairpersons, our special ed coordinators, and our IEP facilitators at the school. They're the persons that are responsible for turnkeying specific information to their teachers in their building, and so we do a lot of support with them through our monthly chairperson meetings, our after-school clinics, and presentation development. We also have divided this group by elementary, middle, and high because there are certain policies and procedures that may only govern our secondary schools versus our elementary schools. And so really we work to build their capacity through support. As far as develop, we really work in terms of how we do it. We really wanted to have a blended model. That was a lot of feedback we got from our teachers. And so we look at an asynchronous training and synchronous training. So we do provide about 128 sessions that are available asynchronously. Those trainings are typically anywhere from 15 minutes to 45 minutes, depending on the topic that teachers can have access to or our support staff can have access to. We've had about 7,400 of our employees access that between August 23rd and February 24th. The other type of training that we do is in-person synchronous training. This could be half day, whole day, during the day, or after school. We do have a certain amount of topics that we do during the school day, and then some, of course, after school. We've offered 252 sessions this school year, and about 8,000 of our employees have taken advantage of those synchronous trainings. For our administrators and principals, you heard me highlight that we've been focusing doing systemic principal meetings this year on specially designed instruction. We also have a pathway for our support staff, which is our paraprofessionals and our itinerant special educators, and then our general and special educators and service providers are also another group that we focus on. For collaborating, we work very closely with our division departments, so our curriculum and instruction, as well as the Office of Professional Learning. We work very closely with them through our resident teacher program, professional educator induction program, and then all of our systemic professional learning. So working very intensely and very closely with those two departments. For facilitation, we really look at instruction. Again, we believe specially designed instruction is the paramount to what we do. We know compliance will take care of itself. We're still obligated to do compliance trainings, but we definitely focus on instruction as our first prong approach. And then we do compliance and behavior. Again, from August 23rd to February 24th, we have trained over 15,535 employees in our district. In terms of managing, we have to do all the course creation, scheduling, registration, and attendance. And then through our grants that we have from the state, we're able to pay staff after school to attend our clinics as well as our professional learning opportunities. So again, you see the number of courses that we have provided this school year, which is 380 courses. This slide just provides you some feedback from some of our school leaders related to the training. You'll see that some of the highlights as it relates to Gold Book, it was a face-to-face training versus our social emotional learning PD that was self-paced for individuals to really give them some strategies and feedback. So I just shared that with you. And these are the big buckets of our professional learning categories. So when we looked at our 380 sessions that we've offered this year, they do fall into these high level categories here. We also thought it was important just to share information about our Family Support Center. So we do have 4 full-time employees that work in our Family Support Center. We actually, MSDE was just with us a few months ago and indicated that we have the largest Family Support Center staff among all the districts in Prince George's County, and they really gave us accolades around the work that we're doing with our families. And so when we think about the support that we provide our families, we give them information about their child's disability, we attend IEP meetings, we provide them with community resources and partners to really help them. This is kind of how we do it, a variety of workshops, support groups, community outreach. And then on the next slide, what I wanted to share with you is just our data as of March 1st. We've had 362 contacts. Those are families that are actually calling in to the Family Support Center or families that have taken advantage of our initial workshop when their child has just been identified. So we've had 362 contacts, again, as of March 1st. Our team has went to 123 IEP meetings this school year, and again, they are there to support the parent. In terms of the process, the decision-making, sometimes they caucus during meetings to explain things to parents, but they are there to really support that parent through the process. We've had 37 workshops, and we've held 3 conferences or fairs so far this school year. This is more information. We do have a YouTube channel, which is great for our family school community, in that any workshop that we hold or any presentation that we do put it on our YouTube channel so that parents and family members can go back to it and review any of that content. We also have a Twitter account where their parents can follow us, and then they can also sign up for our newsletter. These are our staff members. We also have a full-time bilingual parent liaison who's bilingual in Spanish, who does a lot of support for our community and multilingual learners. Now we're going to get into our special education monitoring systems and structures. We are required by the U.S. Department of Education to have a monitoring process of self-reflection and continuous improvement. We also are required, the state of Maryland is also required to monitor local districts. So I'm going to talk to you about how Maryland looks at us and then how we look at ourselves. So as we think about continuous results for improvement, the Maryland State Department of Education on a rolling cycle does monitor us programmatically and fiscally. This year, we actually are in that monitoring cycle where they will be looking at IEPs across our district. They will actually be going into schools, conducting observations of our students around specially designed instruction. They will also be holding interviews with parents, students as appropriate, general education teachers, special education teachers, and building principals. They will also, again, be looking at our policies and procedures to make sure that they are compliant. So that is happening this year. We just had our kickoff meeting on Monday, and they will be monitoring us again beginning this month through the end of the school year. For Prince George's County General Supervision, we look at it through programmatic as well as fiscal. We have developed a monthly accountability checklist in which our special ed instructional specialists meet monthly with principals to go over specific indicators that are important as we look at it by the month. We also have developed a rolling agenda that has specific agenda items that our specialists must go over on a monthly basis with principals. One of those longstanding data points that we look at is intervention data, that they have to look at, are we on track or are we off track? If we're off track, what are we going to do to mitigate that off track or students not accessing their interventions? We also have a special education monitoring plan that we've developed that talks about all of the salient pieces that we monitor, and you're going to hear a little bit about that in just a moment. We also have a monthly fiscal meeting with our budget office as well as our grants office to look at our general funds and restricted funds. And we also have a monthly Medicaid meeting in terms of looking at our funds and how we're expending those. For our IEPs, in terms of how we audit them, we look at 2 IEPs from every single school in Prince George's County. So we do monitor 2 IEPs per school each school year. For our non-public, we also monitor their IEPs, and we look at a random sample of about 3%. Our data management team pulls a random sample, so those that are auditing do not pull the sample. We do have a separate team that does that for us. And this year, we did our monitoring from November 23rd to March 2024. People often ask, how confident are you with the monitoring results that the employees of Prince George's County do? So the way that we do our inter-rater reliability, for every IEP that's reviewed, we use 2 central office team members that review those IEPs. If we have items that are not in agreement between Auditor 1 and Auditor 2, they are then sent to a third rater that looks at what the Auditor 1 said, what Auditor 2 said, with their notes, and then makes a final decision. So our inter-rater reliability for our audits is about 88%, which is really good. We're trying to get to 90, but we are at about 88%, which means that when we're looking at our audits, that we have 88% agreement between Auditor 1 and Auditor 2, which is really good. On this slide, it shows you our IEP development areas, and we've given you our trend data from 2021 to 22, 23, and then from 23 to 24. So you can see how that data shakes out. There are 2 areas that we are still working hard on. That is the statement of how a student's disability impacts them in general ed, and making sure that the IEP goal is measurable. So we do use SMART goals. They need to be specific, they need to have a time frame, they need to have conditions, and we are finding that some of those key areas are missing from our IEP goals being measurable. So that is 2 areas that we're continuing to work on. As far as the IEP team process, we are continuing to work on to make sure that we have appropriate team members at the IEP meeting. And I can tell you, one of the areas that we still wrestle with, you heard me say 73% of our students in general are in general ed, and one of the findings that we saw is that oftentimes the IEP team is meeting. The student who's in general ed doesn't have the general educator in the actual IEP meeting with them. So that's an area we're continuing to work through. We know we are experiencing sometimes shortages, and it's hard, and so we're trying to talk through ways and be creative of how that general educator can participate. And we can also, the law also allows us to excuse an IEP team member. So although parents are excusing those team members, it's still an obligation and requirement that those general educators are in those meetings. Evident of progress, you can see there, results of assessment. It's another area we continue to struggle and are challenged with. And this simply means that on the IEP, when a student takes a state assessment, that those results are on the IEP. And that's important that that as students articulate from elementary to middle or middle to high, that we know what those scores are right on the IEP. For support and related service monitoring, we do look at about 4% of our related services every quarter to see if those support programs, services, and related services have been provided to students. So each of our instructional specialists for their discipline area are looking and monitoring those IEPs. So for our support service audit, we look at adaptive physical education, vision services, deaf and hard of hearing, and assistive technology. You do notice for quarter 1 that we weren't at 100%. That data set did represent 3 out of 4 students. So one of the students did not have all of their data filled in. Our position as a district and our position as a state is that any student that misses support services or related services must make up those services. On the next slide, you see that for speech and language, this dropped from last year in terms of all students having all of their sessions. We are experiencing about a 20% vacancy for speech and language pathologists in our district. The approach that we've taken from our vacancy plan is to ensure that if you have speech services on your IEP, that you are at least getting 50% of those speech services. In the past, we had students in our district that went all school year without a speech and language pathologist touching them. We did not want to do that this school year. So we worked on a plan where at least 50% of those sessions, so if you're supposed to get 4 sessions a month, based on our plan, you're getting at least 2. With the contingency that in the 3rd and 4th quarter, we're beginning to make up those services, and then we do send letters out for parents, giving them options of how we would make up those services in the summer. So this is an all or nothing. If we miss it, we have to make it up. So I did want to bring that out to your attention. But we are impacted, again, by vacancies throughout our related service area. Orientation mobility is the area for both quarters where we're at 100%, and then audiology for 1st quarter. We're still working through our 3rd quarter data, and then the team will wrap up in 4th quarter. For our secondary transition planning and monitoring, in Maryland, this is different from the federal regs in which students have to be 16 for a transition plan. Our legislative body or COMAR regulations say that at 14, students in Maryland must have a secondary transition plan. We also monitor this every quarter. The secondary transition plan talks about agency linkages. Have they been linked with developmental disabilities for those students who may need that? Have they been linked with developmental rehabilitation? Do we have a career inventory interest assessment done for that student? What is the student's goal that they want to achieve once they leave us? So it has several different components that we have to make sure that it's included in that secondary transition plan. This is a state performance plan indicator in which the state measures against us. So if we look at our quarter 1 and quarter 2 data, you can see that the number of IEPs that were reviewed, and we were at 100% compliance. So we've worked very hard with our middle and high schools, and they continue to meet the mark, and we have been 3 years in a row, consecutive years, meeting this indicator with 100%. For our functional behavior assessments and behavior intervention plans is another area that we do monitor. This is also part of Administrative Procedure 5062, which is our student behavior intervention administrative procedure. We do a desk audit of this particular documentation from our Maryland online system. When we look at the different areas that we monitor, we're seeing that great IEP teams are determining behavior needs of students. Where we are falling short is for IEP teams to consider the need for a functional behavior assessment. This means that when we looked at the IEP either demonstrates that there's a goal area and a behavior area, the present levels indicates that there's a need, but yet we don't see any documentation of the functional behavior assessment was completed for the student. This also is true for for teams to consider the behavior intervention plan, and then for teams to develop a plan. So we're also seeing that only 36% of our IEPs this year, where teams did do the functional behavior assessment, there is evidence of a need, but the team did not move forward with the development of a behavior intervention plan. The other piece that we're seeing more work that still needs to be done is the alignment between the IEP goals under that social emotional behavior area and the target behaviors that are on a student's behavior intervention plan. So making sure that we have alignment and connection between these are the target behaviors that we're focusing on, and that we make sure that we have an IEP goal that also shows that alignment. So again, we are continuing to work with our school teams on that particular piece. The other piece we do in our district is physical restraint monitoring as part of, again, Administrative Procedure 5062. We do that each quarter. We do monitor our data as it relates to students with physical restraints. And then you could see our trend data here that just shows you how we have done this particular school year. As of March 1st, or I'm sorry, February 29th, we had 33 students that was restrained in Prince George's County, 48 incidents. So there 30 out of the 33 students, there were a couple students who had multiple incidents of restraint. In Prince George's County, seclusion is prohibited, although we do monitor our students in non-public schools that have that particular physical intervention. Again, you heard the data points that I highlighted of areas that we still need to grow and build capacity and focus on. Again, making sure that our goals are measurable, making sure that we have a presence of a progress report each quarter, making sure we have the assessment results on the IEP, making sure we have appropriate IEP impact meetings, and again, making sure that our teams are developing and implementing functional behavior assessments and behavior intervention plans. Once we do all of our monitoring, we do provide those individualized results directly to the principal and the instructional director. We do share those individual results of those 2 students that were monitored. If there are specific corrective actions that need to be done, we do communicate that with the school. We also may have to convene IEP meetings because of a particular area that was not in compliance. Then we also address professional learning and coaching so that we can look at those improved results. And then central office may have to reach out to make sure that before students or before staff leave for the summer, that they are making sure that they make those particular corrections. For our fiscal monitoring, and this is the last segment of our presentation, when we look at our financial monitoring, I do have a financial monitoring team under my business operations coordinator that really looks at our general funds, restricted funding, staffing, and our financial dashboards. We do participate, as I indicated earlier, in the MSDE, Maryland State Department of Education audit. They look at our equipment, restricted funds, staffing, written policies, and procedures. We also participate in the comprehensive annual financial report, and you can see those particular areas they look at. And we also participate in the A133 audit annually as they look at our federal grants, written policies, and procedures. As a handout, I gave you our business intelligence dashboard for special ed monitoring, and I did provide you with a handout so that you could see some of the areas in which we do monitor. This really has been a game changer for our schools and central office, for our principals, for our area office, because they have the business intelligence reports right at their fingertips, so they can go in and pull reports on demand every day to see how schools are progressing with their data or areas of concern. And so some of the things I've given you in your packet are things like how many of our students are getting a certificate versus a diploma. If they're getting a certificate, is that checked on the IEP? So making sure that if they're getting a certificate, that is also indicated on the IEP. We also have Up at a Glance, where we provide schools with 30, 60, and 90 days at a glance of IEPs that are coming due or reevals that are coming due. We also have overdue reports that we provide schools that they can pull down in terms of anything that may be overdue. That also helps us with our contracted present learnings, where we may have a high number of vacancies, where we can then provide a central office approach to helping those schools get their reevals completed, or they may not have someone trained at the school because maybe they have left. So that also helps us in providing that support to schools to make sure they are staying in compliance. We also have our progress report data, and then we've provided you just with some snapshots of how we look at pivot tables and our dashboards to help as we monitor our students and look at our trend data. This list just gives you all of our BI dashboards and reports that we have, but we do have over 65 reports now in how we monitor special education in our district. And so that concludes my presentation for this evening.
Thank you. Any more comments from you, Superintendent House?
No, ma'am, we just really appreciate the hard work that that our academics and special education team have really forged forward with. We know this is difficult work, but we know our students are worth it, and a number of them have the needs that are necessary to ensure that we provide the best pathway forward. So thank you to my team.
Yes, and I will say thank you for a thorough report. It seems as though you've captured everything. We'll see what questions it generates, but thank you so much. This report is thorough. I see 2 lights, and we will go to Board Member Adam Stafford and second Board Member Wright.
Dr. Bowman, I just want to say I just had a chance to look back at our academic achievement meetings from 2022, and I can just say this report, this work has just expanded and come such a long way in just 2 short years. So shout out to you and your department. I know you all are working really, really hard, and especially just around making that data transparent for schools so that they can act. I mean, just fantastic. I'm very excited to see the growth. And so much so, I'm wondering how can we get this featured prominently on our webpage, especially the family support center, because that is one of the areas where we as board members receive a lot of information. So I wanted to let you know I see that hard work y'all are doing, because the report is drastically different in just a couple of years. I had a couple of questions just very specifically around staffing. Sort of what are we doing to fill that gap for highly qualified special education educators, attracting them to our district? What incentives are we giving for them to come and stay here and work here? Additionally, I wanted to get a better understanding just about, I believe it was page 48, looking at some of the challenges that we're having in FBA fulfillment and completion, and really I'd like to know what is your analysis on how that relates to some of just the administrative constraints that special education and just regular teachers have in doing special education, IEP work. Several years ago, we proposed a budget amendment that would provide more time for schools to meet, to look at those reports, to develop those functional behavioral, to analyze those things. I mean, is that still necessary? Because I'm looking at that data, and those are really, if we can put that slide back up, what was this, page 48? Can we go back to that? You know, having time to meet, to go through the plan, to say, okay, did this student take the behavioral assessment? Are they on a behavioral plan? It's time. So how can we support, I don't know if we can get that slide back up, how can we support as a board? And then just one of the post-graduation question, I don't know if you mentioned that you all are having that college education career, did you mention that in the beginning? You want to talk about it really quickly, just what's happening right now?
Yes, so we actually are at Fairmont Heights High School this evening doing a college and career fair that is focused specifically on students who have IEPs and 504 plans. So we do partner with the Department of Student Services to really bring in colleges and universities across the state. We also partner with our military branches to bring them in, and so parents are there now getting a lot of information around what does it mean when my child exits Prince George's County, because it's very important for parents to know that you move from an entitled service to an eligible service. That
is fantastic. I wish that we could have promoted that, but my question is about post-graduation services. Are we working with groups like the ARC to help make that post-graduation bridge? So those are my 3 questions. Thank you again.
Okay, thank you. And definitely I echo your sentiments about the work that's been done. The team is working very hard and continues to do that. So thank you for recognizing that. As far as attracting our special educators to our district, we do partner with our Division of Human Resources on a variety of tasks. As part of, as you know, Blueprint Pillar 2 really talks about all of those different pathways that we use in attracting special educators to Prince George's County and the partnerships that we have. So we partner with area universities, Johns Hopkins, Bowie State, University of Maryland, Towson, to name a few, Howard University. One of the things that we're really trying to build is the capacity to bring in internships to help support those interns and have them work with us when they leave. And so we have definitely and increase the number of interns that we have working in Prince George's County. What's happening, we just had a collaborative meeting with our Division of Human Resources yesterday, and one of the things that, Tuesday, one of the things that we are doing is looking at that recruitment and retention plan and providing feedback to them. And so we are going to be working collaboratively on looking at the current retention and recruitment plan and then giving some feedback. So we do have a separate work group that's working on that as we speak. And then your other question around the administrative constraints and time as we think about functional behavior assessments and behavior intervention plans. We did negotiate several years ago that all special educators do have 5 days of planning time in addition to the regular planning time that they get, or 5 days of planning per school year. So that was something that was negotiated as part of the update to the negotiated agreement. And then there's a block of planning that teachers have to have each week. That's part of the negotiated agreement. So we try to give them ideas and tools to be able to have that time to plan and talk with each other through various meetings that they have in their school.
Is there a way to find out if that's being protected for teachers to do this administrative work that's so crucial to special education? Because hearing that they have this dedicated block, is that part of your audit to find out if it's being protected at the school level?
So we don't currently audit and look for the 5 days of planning. That is something that I believe our human resources could provide in terms of how many teachers are accessing those 5 planning days. That is data that they would be able to pull. There is a code that the schools have to use when teachers actually access those days. I can say that has not been something that's come up as a concern through my monthly meetings with PGCEA. So I do meet with myself and Dr. Liz Faison. We do meet monthly with the Prince George's County Teachers Association. That was a concern in previous years. That has not come up so far this year as an area of concern in terms of accessing those planning days. So I would take that as it's going smoothly and that teachers are getting those days, special educators specifically.
Thank you so much. I would like to remind board members you will have 2.5 minutes to ask questions, and also the administration an additional 2.5 to answer the questions. And then I'll ask the ladies, we don't have the beep anymore at the end of, did we change it, the system? That's okay. We need to keep our eye on it. Thank you. Next, we have Board Member Rout.
Thank you so much, Madam Chair. Thank you, Dr. Bowman, for your very comprehensive just presentation. I think my experiences as a parent of 2 children with special needs is very different than what's being displayed. And I think that is the reality of most parents in our school system, barely trying to navigate, supporting their loved one, in addition to the stressors, the regular stressors of just living in the world, right? And so I'm wondering if there are ways that we have thought about of capturing some real-time data when you do have the parents present at their IEP meetings. I know I have attended other IEP meetings because I have the fortunate experience of being a foster parent in the state of Maryland. So I support children from all over, every single county. So I've touched many different counties as a parent of a child with special needs, right? So what I'm trying to understand is, have we tried to look at any of our real-time data at the IEP meeting, looking at those culture surveys, talking with those parents right there, capturing them there? Because oftentimes with all of the paperwork, we know about the administrative burden on the parents. The teachers and the paraprofessionals, let's think about the parents. They also have an administrative burden, and I think right there where you have their attention, that would be a better way so that we can really fine tune and improve the experience for parents. I've had a child who really struggled this school year academically, and unfortunately resulted in having to leave our school system. There were red flags that were stated along the way through my advocacy, and so I just wanted to know, at what point does the SPED team cross over with the behavioral interventionists that are supposed to be working collaboratively? Because I think there's a gap in where those two connect. Oh, that's SPED, that's IEP. Oh, that's a BIP. Well, even though the BIP is on the IEP, but that's something different. And then there are the regular woes of being a student, right, that come in. So then what type of support do we give to our cafeteria worker who unfortunately got sprayed by green beans today because this, young person was so disruptive, right? What training are we giving universally, all of our parents, teachers, and some of our support staff to be able to respond to the needs of our SPED population? Those are my only questions right now, and I would like another round.
Thank you.
Thank you for your questions. So in terms of real-time data, we do have a parent survey that MSCE does over a 4-month period that we definitely, as far as our toolkit, encourage our IEP teams to share with families so that they can complete that survey. Although that is sent directly to MSCE, we are doing family focus group, interviews right now. And so I think that's something that we can take back just to kind of talk through how could we look at getting real-time data as part of those IEP meetings when we come into contact. So that's something I'll take back to our family support staff just to think about some ideas of how we can look at, even if it's 2 or 3 guiding questions, that perhaps that we can look at to get some real-time data around parents' perceptions. The other piece is when we look at this holistic approach of behavior, we all own behavior, right? So to your point, transportation, cafeteria workers, schools, we do have universal trainings that we do with our transportation staff that's done, every year. We do have behavior strategy trainings that we do across the district. We are partnering with student services to really look at what toolkits can we build to really be able to support how we look at behavior across the continuum of staff in our building. So we are partnering. Timothy Hips, who was in the Department of Special Ed, just became the instructional specialist in student services, and his wheelhouse is really around the MTSS, multi-tiered systems of support, behavior. So although he is not in special ed, he has got a promotion over in student services, and that is his primary focus around that work and relifting that work. And so that's something that we are working collaboratively, to your point, and building that toolkit to support all of our employees.
Okay, thank you. Board Member Juanita Miller.
Thank you. Excellent report. Thank you. My question is in reference to the non-public population, and I didn't see any statistics in terms of the percentage of those students that are being returned back to the public school setting, because that is a costly venture, and as you know, over the years, most of those, especially those at high school, were referred out. So is there any data in terms of where we are now with bringing that population back? And I know it's very difficult getting personnel, because we can develop the program, but you have to have personnel to implement. So that's why they were being referred to non-public programs. But I just wanted to know, was there any data in terms of our ability to be bringing some of them back?
Yeah, so when we did our strategic plan in 2019, we wanted to reduce non-public placements by 4%, and so we were able to reduce them by 20%. We had probably approximately 950, I can give you that exact data point with my data team, but we had almost 1,000 students that were in non-public placements. We're right above a little bit over 800 right now, just as a ballpark. But I can give you that specific data point. But we did reduce non-public placements by 20% from 2019 to 2024.
And one more, go ahead,
Go
Tommy.
ahead. Yes. because
One more
she has
question.
2 minutes.
I just wanted to know, did we utilize any of the off-campus virtual instruction for our special needs population?
Currently? So, yes, so evening high school, we do have some students with disabilities who participate in the evening high school program, as well as the online specialty program, online campus. We do have students with disabilities who is enrolled in that program. I can give you the exact number. I don't have that number right offhand, but we do have students that are enrolled in both of those programs. You're welcome.
Thank you. Board Member Boozer Struthers.
Thank you so much, Chair, and thank you so much, Ms. Bowen, for the excellent presentation. Many of the board members just returned from NSBA, where we engaged in, really focusing in on what our advocacy mission is, and the full funding of IDEA is at the top of that list. And I think as we went through the state budget and county, our own budget cycle, we learned that there are some misunderstandings about what that means, that the federal government isn't fully funding, and how that impacts PGCPS. So I was wondering if you could speak a little bit to the impact on the program and students, and then the budget impact, and maybe how you would ask for us to, how we can be helpful with that advocacy. Thank you.
So I think part of it is when you look at a federal regulation that says this is federally mandated, and then you break down the percentage of how much of that money is actually coming from the federal government. So I can just give you just a bird's eye view in terms of, if we look at our IDEA pass-through grant that is from the federal government that passes through the district, that amount is roughly about $23 million. If you look at our local implementation for results grant, our secondary transition grant, our family partnership, and all the other grants that we get, if we add the 23 million to roughly about 1 million, that just gives you a snapshot. So if we look at all of our federal pass-through, restricted grants, et cetera, we're probably at about $25 million. If you look at our budget in special ed that was just passed, I know it's going through approval, I think that was almost at 180 million. So that just gives you an idea of what we're getting from the federal government versus what the local and state are having to put in. So when we think about the equity of funding that's coming from the federal government, that just gives you a bird's eye view that we're not, the whole mission of being fully funded, that we're not close to that at all, based on the federal funds that we get in our district.
Thank you. Next, we have Vice Chair Walker.
Hey there, excellent presentation. Thank you so much. I just have a couple of questions. The first is a roundabout of what I think I heard Board Member Rout asking. I just wanted to gain a little bit more clarity on the training specifically for our, not only educators, but those staff that are in the building to be able to help in case they're, faced with anything from our special ed population. So I just wanted you to be able to touch on professional development days and if they're dedicated to special education, behavioral, and things like that, so that we can navigate it. That's question one. The second is just visibility and ease of navigation on our amazing site, pgcps.org. I send everybody there. It's such a great resource. And it would be great if we had this is probably not for you, I'm now looking over for communication. It would be amazing if we could consider even having a button on the first page that is dedicated to, special education, and that can then take us to a link somewhere else, which probably already exists. I just did a search on special education in our pgcps.org, and I think it would be great to not have to navigate so much, but maybe it's, the resources that you talked about today. It already exists, actually, and even things like Special Olympics, because I would love to be, I missed the calling for that. I would love to be able to have the board even attend something like that. It would be great for us to support. And then, so I'll just give you the remainder of my time to just talk about the professional development days, and then thank you so much for your presentation.
Thank you. So as part of Student Behavior Interventions AP, Administrative Procedure 5062, it does require a 5-member behavior team is trained in a variety of training. So they have to go through Crisis Prevention Institute, which is 80% of that is around de-escalation and strategies to support students who may be in a behavior crisis. We do monitor that data with the area office to make sure that we have a 5-member team trained. Where we don't see that they are trained, we do follow up with those principals as well as those school teams to encourage them. Of course, we don't supervise building staff, but we do work closely with our area office instructional directors in making sure that those school teams are trained as part of the behavior intervention. We also do first aid, CPR module that they have to watch as part of that training, and then we also do behavior management kind of 101 as part of that training. So those are the required trainings that the 5-member behavior team has to take as a systematic approach, and then we have additional trainings that we offer that are optional, that are not mandatory. But that is something that we can take back as we work with student services to see as we move forward to next year, are there additional trainings we do want to mandate.
And Vice Chair, I'd just like to mention the second portion of your question that really spoke to the easeability of being able to get certain information. We did crack open our chatbot most recently, and so in the bottom right-hand side of the website, you'll see a little circle that you can click on and pretty much type anything to gather as much information as possible.
The other thing I would just add to that, on the home page, it says academics. If you click there, everything under me, so there's a button for special education there, and we definitely know that we want to make sure that our resources for parents are richer. We just actually did an activity where we looked at surrounding districts just to see, like, how do we validate ourselves? Where could we get better? Where are we missing the mark? So we'll plan to have more coming.
Excellent. Thank you so much.
Thank you. Next, we will have second round Board Member Adam Stafford.
Okay, thank you so much. I'm following up on my first round regarding incorporating, supporting students after they graduate, and if we're working with groups like the ARC. Additionally, I wanted to ask for the students that are being transferred into the non-public settings, is there a specific disability that's pervasive, or is there a trend that we're finding that students are being referred out for? Because I'm just wondering how we're analyzing that data to determine what we can be doing to keep those students here. Additionally, just circling back to what I was mentioning on page 48 about really some of the indicators here around behavioral assessments and behavioral improvement plans, and the IEP teams having time to really incorporate, as my colleague was saying, behavior with the special need. Even though PGCEA may not be explicitly saying that teachers don't have time to do this, my analysis of this data is that they need more time to be able to have those conversations. And so, I think we as the board can support with providing more funding and supporting in that way. But I just love if you all could revisit that or bring that up at your next monthly meeting. And then lastly, I wanted to, see if we could just, I know we've talked about this a few times this year, but really talking about our movement towards inclusion, specifically if you can talk about Pointers Ridge. I know we talked about that school is going to have a specific amount of classes that are going to be specifically for our students with autism, and really talking about our district plan for inclusion, and just having a deeper conversation about that. And I just want to reiterate just my concern about having that many classes where students are separated, and I know that we are trying to integrate them, but maybe if you could speak a little bit more about that. I don't know if I get a third round, but I just want to throw this in there. How are we incorporating students with severe disabilities into arts? And I know you talked about the curriculum, that you all are looking at the curriculum and really thinking of ways that we can be more inclusive, and I just wanted to specifically ask about the arts. Thank you so much.
Okay, thank you for your questions. For the secondary transition, one of the pieces as part of that transition plan is we do have to identify agency linkages. We do have a Prince George's County resource network That includes the ARC, Melwood, and other agencies that we work with. We do meet with them on a quarterly basis just to talk about resources that are available and partnering with those agencies like the ARC to talk about secondary transition planning. But all students who are 14 and over have to have that explicitly documented on their transition plan in terms of what agency linkages will be important for them once they leave us. So we do document that in their transition plan. So we definitely work with a variety of agencies. If you would like work-based opportunities, the ARC, Melwood, if you would like a specific list, I can provide that to you as a follow-up, just so you see all the partners that we do work with. In terms of non-public, our two top disability categories in which we do refer out are students with autism and students with emotional disabilities. So we have our trend data in terms of those being our two prevalent populations that we do send out to non-public, and those are two of the populations that we focus on as part of our strategic plan that we will continue to focus on. That's one of those continuations as we look to our updated strategic plan. In terms of thinking about the movement towards inclusion and thinking about Pointer Ridge, we did develop a training schedule very closely with the principal that listed a variety of trainings and how we look at inclusion. The other piece that's important to note when we look at our elementary programs with autism, we specifically staff them differently at the kindergarten, first and second grade level versus the third, fourth, and fifth grade level. We see more self-contained programs or classes at the kindergarten, first, and second grade level. And by the third grade, we even give less staffing because we are pushing those students towards general education classrooms. We have intentionally looked at that model and really support those students going into their core content classes. And so we have teachers or a support staff beginning at grade 3 that actually push in, because by middle school, they are fully included in general education classes. And so we do that intentional push around inclusion. Sometimes when we think about inclusion, we do have to tackle the belief systems of others. And so we do a lot of work around beliefs and high expectations. And then for our severe disabilities, students with severe disabilities, we did create, and this is not just for that population, but for all students, a specially designed instruction creative arts document or toolkit that we give to our arts, drama, music, PE teachers. And then the last thing that I'll share is that we do have co-located classes where we have our community reference instruction program, for example, with general ed students. So I can explain more about that if you like.
Thank you. For the second round, we have Board Member Rout. Oh, I'm sorry, we have a first round person, so I need to go to that person first. Board Member LaSalle Frazier.
Thank you very much. As I was listening to the conversation that my fellow board members were having, I started thinking about an incident that I addressed maybe 2 months ago. And that is the issue of our older buildings being non-ADA compliant. A lot of our buildings do not have elevators, they don't have wheelchair lifts. And I was thinking about potential students that may have an accident and become disabled but want to stay within their buildings. And as far as I know, they're not being provided with that accommodation. So I'm wondering, what are we doing to change that? I had a parent that was very upset about the fact that their child, although temporarily disabled, not permanently, was not able to be in the same classroom with his peers. So I'm concerned about that.
So I'll take it from the lens of special ed. We do work very closely with Dr. Coleman and his division around accessibility. We do have an accessibility database in which we know all of the challenges and all of the successes. So we do an accessibility review of every building every 3 years to see what their accessibility looks like. We do have what we call emergency evacuations if we have a multi-level building and we couldn't use the elevator. So our schools are equipped with that. If there's a student that specifically may be on crutches, or there's something that may happen that really falls under our student services or 504, our physical therapist from special ed does work very closely on those cases to help troubleshoot. to be able to really support those school teams. But we do have the capacity if there's a multi-level building, because we have to have that if there's an emergency and we have to get out of the building and a student is on the second floor in a wheelchair, for example. So if you wanted to share the specific case, we can try to do a follow-up investigation on that, just see what happened with the decision.
I did follow up on that case, and I did get some responses, but I'm thinking in general, but that was one school, and I know a lot of our schools are old and do not have accessibility, so I know that a lot of our students want to stay within the school they were assigned to, and what I'm finding is that parents are saying that perhaps the children there's a lapse in the time that they can go back to school, or there is not an opportunity for them to be in school, so they have to stay home until they're feeling better, and that's just not acceptable. They cannot just get work being sent home. They need to be back in the school, and we need to look at our buildings, and if they don't have accessibility, we need to put in wheelchair lifts. We need, even though if they're grandfathered in, they need accessibility. Our kids need to stay in school.
Yeah, I agree. We can work with Dr. Coleman's office in looking at that particular case and then cases across, but we do have a process that we follow if the school, is not accessible. So I just want you to know that piece, but we'll work closely with Dr. Coleman to look at that.
Thank you. We will go to first round with Board Member Briggs.
Thank you so much, Chair McInsmurry, and thank you so much, Dr. Davis, for the presentation. I just had a question. I was thinking about what my colleague just shared, and a story came to mind about a parent that reached out for a school that's in my district. I'm not going to say the name of the school, but she mentioned that she has two sons, and they're both in special education programs, and throughout the process of her child being identified for the services, she wasn't getting information that was helpful for her. I think it wasn't being parsed out in a way that I think was relatable as a parent. I know for me, when she was telling me the things, I was realizing the gaps. And so I was just wondering, what types of wraparound services does your office offer to parents, to educators, as we're thinking about communicating what happens in the process of a child being identified, how they're supported, et cetera, et cetera. And then the other piece I had was just around what my colleague Adam Stafford was mentioning around staffing, and I was thinking about virtual educators. I know that I think there are some restrictions around state policy that exists right now, state law, but I was just curious if you all are exploring those options as well, versus having someone in the schools. Are there other options to address some of those staffing gaps virtually?
So in terms of how we support families, in terms of, because the information in special ed, all the acronyms, and that was one of the things that we had saw when we did our gallery walk with another district, just benchmarking ourselves against another district, is the use of acronyms, right? And that could be something that we help to upgrade on our website as an example. But our Family Support Center is always looking for creative ways to navigate and work with families and work with school teams. So we've done case studies this year, because one of the things that we find is sometimes there's a communication challenge with our school teams and communicating with parents. So we've worked on how do you engage a parent, how do you make a exchange meaningful, and so we are working with our school teams through that particular piece. When a student is identified, we do invite parents to a workshop where they can get more information about, now that your child's been identified, what does this mean, and walking them through the parameters of timelines, etc. And then for my last response, I would say for virtual, we are doing our speech and language pathologists. We do have some of them that are providing virtual services right now.
The other thing I would just add to that, when we've worked with other companies, a lot of it doesn't exist. So while you have a lot of vendors that say they can, when we try to figure it out, they can't. So some of the virtual options, we've tried to work internally to create those experiences as well.
Okay, thank you. We will go to first round, Board Member Zipporah Miller.
Good evening. Thank you so much, and thank you for the comprehensive report. And echoing what my colleagues have said, that, from year to year, I know you've presented to us last year, which was amazing, and then it continues to get better in terms of you just outlining everything that you're doing in order to support students who have learning differences. So thank you so much. I was looking at page, I think it was page 37, and you talked about the general educators, and that's an area in which when they have the team meetings, that may be where they may be missing. And then I compared it to, not compared it, but then you talked about, I think them getting their 5 days, and I wonder whether our teacher shortage is playing a part in them not being able to be there, because I'm pretty sure that, with the teacher shortage, there's probably a substitute shortage which needs them to come into the classroom. So my comment, question would be, if there are any ways that your division thinks about that the board could support in that, be it funding or, please let us know, because we know that you're working feverishly to make sure that these areas are covered. So we know there's a national teacher shortage, but if there are any other ways that you come up with that are innovative in order to help the general educators be a part, we definitely want to be of support to.
Yeah, I would say definitely, I think it's less of a funding issue and more of how are we strategic to try to, because even the other data point, you might not see as many days used because there's some teachers not there to use them. So it's not the fact that the teachers that are there aren't accessing it, it's who's not there. So I think our team, and that will come before you. I think even when we look at our staffing plan, one of the things I'm pushing is how we staffed 5 years ago might not be able to be how we staff now. And there may be conversations we have to have differently. So it's less about funding, but how do we talk to MSDE and the state that's going to monitor us and audit us on, we may have to make some decisions on how we have to look different, while the state may say we should have, for example, a 7-to-1, and we might have to say we have to have a 10-to-1. And where are we going to take the hit? Do we want certain points of the data to get better while others, goes down? But we have to make some of those critical decisions, and I think that will be a point, if we get to that, is where we would need your support to say that we had to make the best decision for the students of Prince George's County.
Absolutely, and please let us know. Can I ask my last 2 questions they can answer?
You can have a second round, because you've only had 1 round.
Pardon me?
Come back to you for your second round. Okay, thank you. Now we will go to our second round with Board Member Brown.
Thanks so much, Chair Mickens-Murray. So I wanted to go back to the conversation that we were having about funding. And so I'm not sure if you're poised to answer this, or if Superintendent is even available or ready, can answer this. But I'm wondering, what have we done with participating in any type of studies, advocacy, research, anything, advocacy mainly, around some of our rates. These rates, as it's projected, if it's that much of a gap, that means that the local share is being affected largely. And if you're telling me that 73% of our SPED population is in general ed, right? I love being inclusive, but that means that we need a little bit more of a dollar to be able to support this population, which makes sense for me. So I just wanted to know, are we doing any advocacy with any of our congressmen and our senators to really look at, for an inner city, rather large, second largest school district in the state of Maryland, what can they do more?
We certainly, during this legislative season and beyond, will be continuing our efforts to advocate for our special needs students. It's an ongoing issue that not only in our largest, most urban school districts, but even some of your mid-sized school districts that have major struggles in terms of funding as well. But it's not just a state issue; it's also a federal issue. So we have had time, testifying at the Capitol around funding and support, and we'll continue that work as a part of our legislative agenda as we move forward.
Yeah, I would really like to see the policy and governance to really take this up on the federal level, possibly, moving forward. And then just quickly, with that rising, how are we projecting the growth of our need for future paraprofessionals? The workforce, oh my gosh, it's slammed all over the place, and I get it. I'm in behavioral health. But what are we doing to prepare ourselves? Like, we can see the trends, we see, like, what are we doing to maybe a freshman class really work with them at a local university? Because we know you'll be out of school in 4 years, right? And so maybe come work with us. Like, are we doing that type of data analysis?
So we do look at our trend data, especially coming out of our infants and toddlers program. So we do look, we start there, and that's how we were able, and this board has been more than generous with FTEs, increased FTEs for special ed over the years. And one of the key data points was around autism and early childhood. So over the last several years, we have made investments to increase those staffing positions for those two populations based on our trend data. So we appreciate that. The other thing this board did is for infants and toddlers, we upgraded those positions to 11 months from 10 months because we know special ed is a year-round program. So that was another big investment that this Board of Education made for special ed.
The other thing I would add is our Chief of Human Resources is working with a Grow Your Own, and there's bills that are going through, funding to support it, to work with our students that are internal. The other piece to that is our CTE programs are looking for, we are a registered apprentice, Prince George's County Public Schools. We are actually the only school system that is an actual apprentice. So one of the things that we're looking at is how can we grow our students and build internships internally, and paraprofessional is one of those opportunities. So more to come on that as we begin to plan for our students in our district.
Thank you. Vice Chair Walker, second round.
Yes, thank you, thank you, thank you. Thank you, Dr. White, for letting me know. I found all of the information. I'll definitely post it under academics. Thank you. Ms. Bowman, a number of emails that I receive are around IEP development, the meetings, and adherence to IEPs. And so I was looking at the numbers here for the audit reports and the audit results, and a number of them are in their 90s, which is amazing. There are a couple, though, like the goals being measurable or things like that, that are probably a little less than stellar, like appropriate participants for an IEP team. And I was just hoping, whether or not you state it here or you just look at it outside of here, that we could just understand what are we going to do to increase those. I know that I always send them, I send them out and I know you answer them, but I think if you could just take a look and maybe even talk to us about some things that might be happening for the development and adherence to these, and the audits under parents being comfortable with their IEP meetings happening. That's one. The second, I think, is kind of easy. Do we have exit interviews? So I've heard a number of people, small population, but even I heard our board members say that they have special needs children and then they end up leaving PGCPS, and we don't really want that. And so I'm just wondering, do we do exit interviews with the small population so we can then improve internally so we don't have any trends that's happening there? And then the last one, which I don't need you to talk to, we just did, I just had around the advocacy for legislators on proposed bills as we work for next year.
So we know when we looked at our audit findings, there's 37 schools in our district that fell into those big rocks of areas of improvement. So one of the things that the results have gone to those principals, and then my charge to my team is to develop support plans with those school principals and their special ed chair or coordinator to improve those results, to really look at at least two of those areas and target actionable steps for next school year. So that's one of the things that we're doing as it relates to the audit. So only about 30, when we look at those 5 areas, only 37 schools really fell that really drug down our data in those particular areas that we're going to be targeting and focusing on. And then for our exit interviews, we are required by law to do an exit meeting for students who are graduating, either with a diploma or a certificate. We are required to have an exit meeting for those students, but students who may transfer out of our district, we don't currently conduct exit interviews. But that's something we can take back and look at as well.
Thank you.
Thank you. Second round, Board Member Zipporah Miller.
This has to do with the speech pathologists, and I know that number is because there is another shortage, right? And I'm wondering, and this may not be possible virtually, would Hazel Health have access, and would it be something that we can use since it's what is it called, a program we already have with the school system, with Hazel Health. There may be some restrictions, or maybe the speech pathology services could not be done virtually. So that was the first question. The second part is just a comment, and I just wanted to make sure that this was on for public record, that your team, superintendent and Chief Academic Officer Judy White, have shared with me the plans for Pointer Ridge, outlining everything that is happening. So I just wanted it to be a statement for the general public, down to when you're doing the parent meetings, the maintenance of the building and getting the building prepared. And I wanted to know, just to be a public record, that as a board member, I did receive that, so it doesn't seem like it hasn't. I am aware of everything that's happening, and you've been keeping me updated with everything that is happening, and I thank you for that. And I will share it with my colleagues, but thank you for keeping me updated on that.
So my team definitely is constantly looking for partners, particularly for speech and language pathology, to provide either in person. We know the population that we can provide virtual services to, because not all students can receive their services, virtually. And so we can explore. I'm not sure if the team has looked into Hazel Health, but I can take that back to them. We currently have about 4 vendors that does provide virtual speech services, and we're constantly always meeting to see if we can expand that. But sometimes, as Dr. White indicated, vendors will say, oh, we can provide this, and then when we get down to the meetings to have those discussions, we find that they cannot.
Thank you so much.
Thank you. I have 3 questions. The first question on page 48, I know the school year 23-24, we dropped in 5 areas. Can you explain why?
What I would say to you, part of that issue is definitely garnered around our long-term subs, or subs in general, that they are working closely with a certified special educator, but that is definitely an area of need in terms of building capacity of our long-term subs, who many of them may or may not hold a certification in special ed, and that's the biggest impact that we've seen this year. And we've had to employ central office to help support those schools, but that's one of the impacts that we've noticed as we look at where we dropped, the schools that we dropped in do have high vacancies. We did tier all of our schools as green, yellow, or red, and so many of the data that's navigating in those areas are schools that we've flagged as red schools with a high absenteeism or vacancy.
Okay, well, please share with the board if there's anything that we can do to help you get those resources. Second, I was looking at page 41, when percentage of students receiving 100% of the services. When they are in general population, do we give them is there a teacher and an assistant in that classroom? Or are we struggling with that as well?
So it really depends on the IEP and at what level the student is working. So we may have a situation where at the secondary level there's a co-teacher. It may be a teacher, a special educator, and a general educator. It could be a dual certified teacher who's certified in special ed and general ed. It could be a paraprofessional in a room. So it really depends on what the IEP calls for. We also do pull-out services where a student may be getting pulled out for their intervention. So it really depends on how that IEP is structured. And when we do our staffing, we take all that into account and provide, again, those staffing resources to schools based on looking at the IEP service hours and the courses at the secondary level the students are enrolled in.
Could you give us a report to just give us an idea of what that looks like? And if the students are missing some resources in a classroom because we have taken them to the next level, then that helps us to identify the additional resources that you need. And finally, I just wanted to make a comment. The Maryland Association of Boards of Education, when we did our advocacy on Capitol Hill, what we found out is that the federal government is only funding 13% of what they should be giving since 1990. So I am suggesting that school boards join forces across this country, because that's a population that needs more. And to allow the congressmen and the senators to not recognize that and to help us to get what these students need. So that's not just here in Prince George's County, that's across the country. Okay, so I just wanted to put that out there, Superintendent House, when you go to Capitol Hill next year. Okay, thank you so much. Thank you all for this great presentation. It was thorough.
Can I add one more thing? I just want to publicly,
Who's talking?
I'm sorry, I
okay.
want to just thank Trinell and her team. A lot of the things that you hear come from areas in the school. Know that when we receive your concerns, whether it's the school side, Dr. Davis's team, along with Trinell's team, we go and investigate and research every single one. I always like to make statements because I know I have parents that are watching. We service 16,000 special education students. Clearly, you're not getting 16,000 complaints. So there are areas where we're doing it and we're doing it really well. Is there room to grow? Absolutely. My team has grown. We are committed to continually getting better. And the two things that really struck with me today is Board Member Rout asking at that space and time, like maybe we need to do a Google form to capture. Parents can fill out an exit survey, maybe looking for some of those students that leave to continually think about how we can get better. So thank you for letting us present today.
Yeah, and you know, one of the other things too that I noticed when I looked at your staffing on page, I think it's 32, you have a small staff for the number of students, and they're special students. So I am wondering, do you need to get more staff? And if you do, you need to let us know that, or please start with Mr. House and then come to us for that assistance. Because when I see one liaison and speaking Spanish and English, to me, that's not enough for 16,000 children. Okay, so I'm just putting that out there. Thank you. Now we will go to 3.2, bail time implementation update. The chair recognizes Superintendent House for an update on the bail time implementation.
Thank you, Madam Chair, and I'd like to invite Dr. Sharaska Coleman as well as Kiba Baldwin. On top of Dr. Coleman and Mr. Baldwin, we'll have the Chief Executive Officer on via Zoom, Mr. Carl Allen from Formative. And joining Carl Allen via Zoom will be the Chief of Client Services, Mary Dillman. So at this time, I'll turn it over to Dr. Cole.
Good evening, Board Chair Mickens-Murray, Vice Chair Walker, and members of the board. Thank you, Superintendent House, for this opportunity to clarify the prioritized recommendations from the Transportation Action Plan. Joining me this evening, as you stated, is the Director of the Department of Transportation and Central Garage, Mr. Kiba Baldwin, the Chief of Communications, Ms. Tejal Patel, and key members of the Student Transportation Strategy, Technology, and Management Company, Formative, Mr. Carl Allen, CEO, and Chief of Client Services, Ms. Mary Dillman. This evening, are we able to show the presentation, or? Thank you for that. Thank you. I have the clicker, but it's not advancing the slide, so I don't know. There we go. We may just have to do it the old-fashioned way. This evening, we plan to focus on the following: revisit our why, dig deeper into the school year 24-25 prioritized recommendations, provide communications updates, reiterate the projected benefits from implementation, and engage in questions and answers. As we know, we're engaged in this improvement process because the formative audit confirmed what our community has been telling us, that there is a critical need for transportation to adjust practices and ultimately improve the on-time, safe arrival of students. At this time, I'm going to turn the presentation over to Formative to revisit our why based on the audit findings. And the next slide, please.
Good evening, everyone. I'm unable to turn on my video if that could be enabled, but I'm happy to speak without it.
Thank you.
Can you all hear me?
Yes, sir. I was going to confirm for you. Yes, sir, Mr. Allen, we're hearing you loud and clear, so you can go ahead and move forward.
Okay, My name is Carl Allen. I'm the CEO and founder of Formative Technologies. We are a student transportation strategy, technology, and management company that takes a highly analytical approach to system transformation and holistic sustainability. Our team has a depth of experience across education and mobility. Myself, I was formerly the Director of Transportation for Boston Public Schools and have also served as Chief of Operations and Finance for a charter school network, was a former teacher in the Peace Corps, and I'm trained in industrial engineering and urban planning before starting Formative. Mary Dillman, we also hear from this evening, is our Chief of Client Services. She's a former teacher, a Teach for America Corps member, and was Head of Data and Accountability and Chief of Staff at Boston Public Schools. The audit that we commenced this fall, working with the superintendent and with PGCPS staff, was with the desire to create an objective assessment of the Prince George's County transportation system operations, and had three identified key opportunities for improving school transportation. Our goals were to get a comprehensive picture of performance opportunities and system performance by gathering data, including with a site visit, interviews, focus groups, policy and document review, and understanding the system configuration details, design, and finances, analyzing the existing student transportation system, identify strengths and areas for improvement, recommend solutions for immediate stabilization, for long-term improvement, and also holistic sustainability, to propose and provide recommendations regarding revisions to systemic practices or policies, and then to estimate the potential gain and also trade-offs and risks from implementing various proposed solutions. Our ultimate report outlines findings and recommendations in 6 areas around the landscape, the service configuration and design, supply, organizational capabilities within the department, system performance and efficiency, and resource stewardship. So as part of the audit, just to speak to the various methods that we undertook, we conducted in-person and virtual interviews with a large number of stakeholders within the system, including staff members from the phone bank, dispatch, routing and scheduling, IT, data, and payroll. Oh, here, I'm allowed to start my video now. Hello. Nice to see everyone. Operations analysts, special education, human resources, student data and pupil boundary, bus lot terminal staff, terminal managers, foremen, transportation supervisors, department senior leadership, members of the district senior leadership team, several school leaders, principals, and a cross-functional group of staff members, also to explore walk zone safety in particular. We also did a student focus group that was virtual and held a focus group and multiple group interviews with members of the PGCPS Parent and Community Advisory Council. We continue, even after the audit, now to gather subsequent data to round out the audit, and interviewing staff members, gathering work artifacts, and documenting internal processes in supporting the next phase of our project, which is helping with system implementation. High-level findings of our audit that I wish to share here. Essentially, one of the most significant findings, and that folks are aware, was that of a total of 5,334 trips completed daily, and as at the time of the audit, over 1,000 trips, about 20% are not assigned to a vehicle. So this is a daily problem that requires adept problem solving to find ways to cover these trips. We looked at the bell time distribution and found that these were not well balanced nor aligned in the AM and the PM. And so we'll talk more about this, but this misalignment and lack of balance of bell times results in inefficiencies with disproportionate needs during the first service tier. Service levels, this is looking at how far students typically walk to bus stops. The average student stop is actually located just under a quarter mile from their home, even though the district policy does allow that stop locations could be as far as 1.5 to 2 miles from a student's home. Seat utilization, just how many seats are filled on the buses, was about 41%, indicating a large opportunity to better utilize the vehicles and fill those seats. Boundary exceptions. We noted that every day the district transports more than 22,000 students who actually live within the walk boundary as measured with a walkout over streets. from a centroid at the school. So we flagged this as something that would be very important to review and to understand why this might be happening and make sure that any safety exceptions that were built in are thoroughly reviewed. Also, that there is an opportunity within the modal and the vendor mix to leverage smaller vehicles in many instances in a strategic way, including outsourced opportunities, rather than necessarily exclusively relying on large yellow buses that require a CDL bus driver. Besides the driver ranks, in which the Transportation Department is severely understaffed, we noted from a staffing perspective that there was also a lack of analytical and technical capacity within the department. We looked at other qualitative and process-oriented measures within the department, including the hiring and qualification processes for drivers, and noted that the process to hire and qualify drivers is long and inefficient, can take up to 10 to 16 weeks in many instances, so you lose a lot of drivers along the way throughout the hiring process. Communication was cited by families as a major pain point. Even while service was a challenge, they expressed that the holding service constant communication was one of their biggest pain points, and their inability to get useful information about late vehicles when they contact transportation. Technology, which relates to the communication issue, there are many challenges reported by staff and that we observed related to the routing system and the Zonar tablets and the parent app and the connection between these various systems. We also noted lapses and challenges within process implementation that are very important, again related to communications, but also just good internal process to help the operation run more efficiently and on time. And finally, use of data within the department to help better manage performance and understand it. So that kind of encapsulates the large areas of findings, and I'll hand it back to Dr. Coleman to share the prioritized recommendations.
Thank you so much. If we could go to the next slide, please. Based on the audit findings, 5 of the proposed 12 recommendations have been prioritized for immediate implementation in school year 24-25 to provide the improvements in transportation that our community deserves. Our transportation team understands and respects that any changes that are made to transportation have an impact on our students, parents, teachers and staff, and our community stakeholders. Given this knowledge, each recommendation is being thoroughly vetted prior to implementation to ensure that we are calculating the projected impact on families and stakeholders while also measuring the expected improvements that we need to make. I'm going to turn the presentation back over to Formative to discuss the bell time shifts first. And if we could go to the next slide.
Thank you. So we'll talk a little bit, and my colleague Mary will explain more specifics related to the scenarios that we analyzed and proposed, but I'll just set the stage a bit with helping with an understanding of the impact of bell times more broadly on efficiency. So generally speaking, school systems can significantly improve the efficiency of a student transportation system by aligning bell times and also spacing them out, and then balancing trips across various bell tiers in order that they can maximize the number of trips that a vehicle can do, and then also maximize the time that a trip can run and therefore pick up more students on any individual trip. So we think about this as a really core and foundational system design choice that then enables the kinds of efficiencies that are possible with routing and that relate to service levels and eligibility and so on. But the bell times are one of these core design choices that really set the stage for what kinds of efficiencies are possible and are highly, this bell time recommendation in particular is highly synergistic and enabling of many of the other recommendations that we've made in our report. Just lastly to say that policy changes at this level, can just are really, really significant, but also impact a lot of stakeholders and are non-trivial to make. So it affects students and families, obviously, teachers and staff, and routines. And so while they are, core levers, they are also, very consequential within the community and the theory of change within a school district. But when we think about optimizing bell times or creating the conditions of alignment and balance that help create conditions where efficiencies are possible, we think about well-defined tiers. And so in these recommendations, we're talking about getting to a better alignment around 3 tiers, more space between bell times, as I said before, to allow trips to run longer and cover more ground, therefore pick up more students, a balance across service tiers. And so that means every bus is able to do in a 3-tiered system, 3 trips in the morning and 3 trips in the afternoon. So maximizing the number of average trips that each vehicle is able to do, and thereby maximizing use of those precious CDL drivers and yellow buses. And therefore also maximizing number of schools that a vehicle and 1 driver can serve. And so in order to modify bell times, again, the goal is to reduce the number of vehicles and drivers that are needed to serve as many schools as you possibly can. And so the amount of efficiency that you're able to gain is dependent on how much balance you can achieve and how aligned you can make those school schedules, and how much space you can create, thereby giving your teams then the opportunity to pair trips in the maximally efficient way. So I'll hand it over to Mary Dillon, our Chief of Client Services, to talk with a little more detail about how we evaluated your bell times and balance, and the recommendations and options that we evaluated.
Hey everyone. So I'll explain a little bit about what we found in the audit and then how we reviewed the proposal that the district team put together. So in the audit, we found that there was significant imbalance of trips across service tiers, in particular with a lot of trips in the first tier of service, so schools that had bell times at 7:45 a.m. or earlier. And so there wasn't a distribution of trips across tiers, and they also weren't aligned, like Carl was saying, to nice even start times that you had spacing between trips to allow each vehicle to complete as many trips as possible. And you want to do that, one, for the efficient use of vehicles, but also just for service reliability and improved performance, which is going to lead to a better experience for students and families. So that lack of balance and alignment that we found in the audit, which we described, led to having some inefficient use of resources and some degrading of performance. So that was shared in that audit that was shared with the district and published in January of this year. And then following that, our role was, provide some advisement, just like Carl shared, around the types of things that any school district should be mindful of if they're interested in or thinking about pursuing bell time change with an eye towards improving student mobility outcomes. And so we shared that sort of broad conceptual framework, and then a cross-functional team within the district put together a proposal. They shared what their final recommendation was and brought it to our team for vetting. So as part of our vetting process, we took in the new proposed bell times that the district team put together for every school, and then went through and evaluated that spacing, the balance of trips, and then what we thought the improved performance and efficiency would be if the district were to implement that model. And so we were estimating improvements based on the stop and the trip assignments, both currently and also as part of the audit, we actually simulated some optimized trips and stop assignments related to stop consolidation. So we also analyzed the model with that in mind as well. And so we are assessing the extent to which the number of schools moved, the number of minutes moved in the district's proposal. And then we provided some high-level feedback to the district on that. And our assessment was that the proposal should eliminate 47 vehicles, and that's on its own without any changes to stop assignment, which, as you've heard from Dr. Pullman and you will hear from Director Baldwin, is something that the district is going to pursue in a differentiated and strategic way. And when you combine the proposed bell time changes with thoughtful stop consolidation, the district should expect to double or triple that number of vehicle savings, which is really going to have a huge impact on performance reliability for families and students. The model we saw has, well-aligned, 3 evenly spaced and proportional tiers of service. Afternoon service was still a little bit scattered due to variation in length of day by grade level, since there's schools, elementary, middle, and high, all 3 bell tiers in the model that was shared with us. So there's still a little bit of less alignment in the afternoon into sort of basically clusters rather than 3. But in our analysis of the team, we still thought there were sufficient parent opportunities that they'd be able to still yield some really significant efficiencies. The bell time changes were modest overall. So 90% of schools.
Okay, excuse me, madam. So,
oh, sorry.
We're having a difficult time hearing you. Your voice keeps going in and out, like you're not in the mic.
Is this better?
Yeah, but I want to share.
Close to the microphone.
I need to share something with the superintendent and his team. So can you hold for a moment, please? Hold for a moment.
Of course.
I think what we were looking for as a board was straightening up the confusion that's out there of the information that's already put out to the community around specifically the bell times. And I appreciate all of this, but you did a pretty good job giving us this information at the last meeting. So what we were looking for tonight, because you have put out information around those bell times, and because there were questions around elementary students going early, then the high school student, that's what we were hoping tonight, that you would give us some specifics around.
Go ahead, Dr. Coleman. I think you
Sure.
want to say the same thing.
We will certainly be addressing that as a part of the presentation, but we've received a lot of feedback from our stakeholders, as I'm sure the board has as well. And so we saw this as an opportunity not just to clarify around the bell time shifts, but all of the approaches that we are prioritizing as a part of the recommendations.
Okay. Vice Chair Walker.
Well, yeah, I'll jump in really quickly. One of the things I think you all did really well the last time was to let us know about the overall, like the comprehensive study, why it was important and what the recommendations are. You did a phenomenal job doing that. I think the next steps for that, and maybe Dr. Coleman, it might be coming, the next steps for that are some of which you have on this document right here, and really just to talk in general about, hey, guess what, this went out, I want to clarify what that is.
Right.
And I see here, you already have strategies outlined, timelines you have, and so I think I think that you did an amazing job doing that, and I think your time is better served to
And I think we can skip forward to that, but I want to first of all acknowledge, number one, that yes, there was a miscommunication due to a review oversight. Nonetheless, we made the necessary correction and continue to move forward with the implementation plan that you guys see in front of you. So at this time, we'll go ahead and talk a little bit more about kind of what the communication plan looks like and next steps.
Thank you so much. So we'll move forward. Thank you, Mary and Carl. If we could move forward to Director Baldwin.
Madam Chair, point of information. Does that mean that the superintendent's consultant is going to leave? Will we be able to entertain any questions to them?
They can stay
Okay,
with us, if that's okay.
Yeah, the instructions that we were going to give was that go through the administration to give that they would stay on the Zoom.
Yes, very fine. The superintendent said they'll stay. I just wanted to make sure because
They're staying.
that they don't go.
Yeah, they're staying.
Thank you very much. Since they didn't finish their presentation, I would like to know, would it be too much for us to hear them finish?
Yeah, we can.
Well, we can, but
Yeah.
I wanted to make sure, first of all, that we could hear.
Yes,
Okay?
correct. Yes.
And then second, the ask.
Yes.
Because the
Very
ask
well.
was a
Yes.
specific ask. Okay?
We're in line, Madam
Okay,
Chair.
thank you.
So again, Director Baldwin, if we could shift to the next slide. In those next 2 slides, what was also suggested at the last board meeting was that we look not only at the prioritized recommendation, but dig a little deeper to talk about what the strategy would look like to implement and what the potential metrics would look like to measure implementation. And so that is what Director Baldwin is going to go into, the prioritized recommendation, the strategies, and the milestones. And as a part of that overview, board chair, he will also clarify around our bell times, what was proposed, and what we, how we plan to roll that out.
You mean just wait one more slide?
Yeah, no.
I'm not going to say that. I'm going to just.
We got it. Wait, 4 or 5 more slides. We got it. Okay, go ahead, Ms. Baldwin.
Good evening, everyone. We are going to start again. I'm going to. You have to see me how I'm over here tonight. All right, so we're going to continue with the bell time shift. This is the strategy.
Can we go to the next slide, please? Thank you.
This is our strategy to standardize our bell times. We currently have 13 different start times that we want to reduce down to 3. We want to streamline our operations to enhance our efficiency and balance the bell times as needed. Again, we want to reiterate that school levels will be mixed by tiers. Factors to balancing our school tiers include the location of our bus lots, the number of assigned trips versus the number of staff per tier. In order for this to be successful, we need to ensure we have balance between the number of trips, the number of staff available per tier. We do not want to overload our bus lots with more trips than staff. This process is complex considering the many factors that are involved. Our discussions included defining our priorities on which we've built the recommendations of our bell times. We developed the scenario which yielded the data that we shared with you at the March board meeting. We plan to share school start times at the next board meeting on April 25th. And then beginning in May and continuing through June, we will build trips, coordinate routes, and assign each bus lot in preparation for the 24-25 school year. So as you see the chart there, we just tried to simplify that with the recommendations, overview of the strategy, and some of our implementation milestones, things that we want to celebrate to make this a successful implementation.
And so I'm gonna pause just for one moment. Thank you, Director Baldwin. That speaks to the bell time piece. I don't know if we want to spend the time going through each of the other 4 prioritized recommendations and the strategy and the milestone, or do we want to skip ahead and speak?
May we get a copy of this slide?
Yes,
'Cause
that
we
is a
don't have it.
condensed version of what was provided to the board, and certainly we can provide you with this copy as
Okay.
well. So we can skip forward and provide further clarity around the bell times, if we choose to do that.
I think at a minimum,
right.
you definitely need to do
Okay,
that.
so let's do that. So if we can, so we'll skip ahead to that slide right there. Thank you. So we're working hard to implement improvements in such a way that the changes don't outpace our community's ability to absorb them. Okay, I'm going to say that again. We are working hard to implement improvements in such a way that the changes don't outpace our community's ability to absorb them. With that said, the prioritized recommendations that have been tagged for implementation are being carried out in a modest, not aggressive way, but are still being projected to provide significant improvements in the overall performance of transportation. If we could go to the next slide. As 2 examples, this top piece is a bar graph that shows our bus stop consolidation. There are approximately 85,000 bus riders on any given day, with an average walk to stop currently of 0.24 miles. So that's that quarter mile, that blue one that's right there in the middle. The top column shows what our current PGCPS walk to stop policy could be, between 1.5 miles to 2 miles. 1.5 for elementary, secondary would be 2 miles. So our current is that blue, less than a quarter mile. What we are proposing based on the prioritized recommendation around bus stop consolidation is to increase the average walk to stop from 0.24 miles to 0.46 miles. still under a half a mile, and well below what is allowed in the policy. So that's an example mathematically of how we are trying to make a modest increase but yield a great result, a significant improvement in our ability to provide for our families. In addition, we will follow a consistent bus stop evaluation process, so no bus stops will be consolidated without a physical review and assessment of the stops to ensure there is safe passage for students. If I look at the bottom column, again, and this is what we need to make sure we clarify it again. Again, it was never proposed or in the plan to shift all elementary schools to one time, 7:30 for elementary, all middle schools and pre-K 8 academies to 8:30, and all high schools to 9:30. That was not in our proposal. That does not match those numbers that we presented to the board and the public in March, and that is not the plan. What is planned is for us to establish 3 distinct tier times, 7:30 a.m., 8:30 a.m., and 9:30 a.m. That includes a mix of school levels like we currently have. Under this plan, approximately 33% of schools will have no change at all to their bell time. None. 57% of schools are expected to shift by 15 minutes or less. So that's what I mean by a modest adjustment. Okay, we had the option under the scenarios that were developed with formative to tier all of our schools, elementary at one level, middles at one level, high schools at another level. We rejected that option out of hand in the planning stages. We knew it would provide too much of it would be a bridge too far for our community to shift, and it would impact our needs for vendor managed before and after care. We would need more. It would impact athletics for high schools. It would create an issue. It would impact our CTE programs as well as students who go to work and participate in dual enrollment courses or the college courses at PGCC. We knew that it would impact our families where some have the older sibling wait for the younger sibling when they get out of school. So for all those reasons and many more, that was left on the cutting room floor and not moved forward, even presented to the board or the public. We knew it was a bridge too far, and we're not going to do it.
Thank you.
So under this plan, 90% of our schools shift either not at all or by 15 minutes or less. That leaves 10% that are dealing with a more significant shift. 7% we're looking at shifting between 16 minutes and 30 minutes. That still isn't a major change, but we needed to be considerate of the fact that that's more significant than 15 minutes. And then 3% of our schools are shifting between 31 minutes up to 60 minutes. No schools under this scenario shift more than an hour. Okay, none. So in other words, there's no school that currently starts at 7:30 that under this proposal would move to 9:30, or vice versa. The maximum shift is for 3% of our schools between 30 minutes up to 60 minutes. Now, what formative was sharing, and let me say this about that. When considering bell times, we looked at a number of factors based on the focus groups that were done by formative, based on the interviews that were done by formative with many of the stakeholder groups all first semester. That was parents, that was principals, that was administrators, that was teacher groups, that was student groups. We took that input from the entire September to December to make sure we understood clearly the priorities that our community laid out so that they had a voice. They were given a structured opportunity on multiple occasions to inform the decisions that were being made. And so that was that first engagement that we wanted to make certain brought the voices of the community into the room so that we weren't blindly making decisions. And so we did look at athletics. We heard about the impact on the instructional program. We heard about work study and students with jobs after school. We heard from families who said that my older sibling has to pick up the younger. We heard from teachers who said, if you shift my time too much, then that's attrition to me. I'm gonna have to leave and go somewhere else because I can't leave my child and get to work on time. And so we baked all of that in and decided that a minimal adjustment would be all we could stand, but it would still yield us with a significant improvement in our transportation system. And so that's why that strategy was selected. So I'm going to turn to Chief Patel. She's going to talk a little bit about the communications plan. I hope we're okay with that.
Yes.
Because that is going to speak to the upcoming engagements that we know we need to continue to have with our community, because we want to make these shifts with our community and don't do it to our community. That's what this is about.
Right, right. Good.
Good evening, board members. This slide that we're showing first may look familiar from the presentation that was given at the March board meeting. So I'm going to take a few minutes to go over where we are currently in this strategy and what are our next steps. We've developed an integrated multi-platform approach to keep all stakeholders informed and engaged. This includes utilizing various communications channels such as our web resource portal, mailers, social media campaigns, news media, email marketing, educational assets, graphics, and video. Next slide, please. Here's a timeline of where we are in our communications efforts to date. We launched our web resource portal on Friday, March 22nd, providing a central hub for information. Then on April 2nd, after we returned from spring break, an email from Superintendent House was sent out to the community and staff informing of the transportation improvements that will be coming. We also shared a toolkit with board members on Friday, April 5th to help spread the word to your district members. This toolkit includes flyers, email templates, and proposed social media language in English and Spanish. Community information sessions will begin on Monday, April 15th in Vice Chair Walker's district, with sessions scheduled almost daily in every board member district until the end of the month. It is critical that we have y'all support and be able to engage with the district members during those information sessions. In helping us to amplify, I noticed that a couple of our board members shared that information on social media. Board Member Boozer Strutt, I saw you shared on yours, and Dr. Harris, I saw you shared on your Instagram stories. So we appreciate the amplification. It is really important that as many community members come out as possible who are able to, so that we can answer their questions in person and provide any clarity or any additional information that is needed, because we know that it is critical to walk with them through this process. Next slide, please. So this is what we're talking about for our future plans and our next steps. Looking ahead, we're currently finalizing the design of social media ads for a paid campaign to launch next week, reaching an even wider audience. So that means you'll see these boosted social media posts on Facebook and Instagram. We are also in the final stages of completing a toolkit for our principals. We know school staff will receive questions directly from families, and we want them to have the talking points and messaging they need to share information around these transportation improvements. Some of the items in the principal toolkit, such as FAQs and key messages, will also be part of the board toolkit that we will send to you all next week. The toolkits for schools will also include approved language and templates to underline our messages at the school level. Schools will also receive printed collateral, including posters, flyers, and one-pagers in languages including English, Spanish, French, Dari, Pashto, Arabic, and Amharic. We'll also be sending targeted emails to families impacted by bus stop changes once those are finalized. And that concludes my update. I'll turn it back over to Dr. Coleman.
Thank you so much. So we are ready to open for questions, but before we do, we wanted to turn it to Formative for brief closing remarks.
That's fine.
Part of why we wanted Formative to be a part of this conversation this evening is that they bring context, having worked with completed this work from across the country, and so we wanted them to talk about our progress towards solutions for a stronger transportation system.
Thank you.
Hi, can everyone hear me okay?
We can, Carl. We can hear you clearly. Mary's is the one that was kind of modulating in and out.
Okay, very good. Well, just to close, I wanted to emphasize once again that these bell time savings, really in collaboration with stop consolidation and our together, the moves and the changes that the district is recommending here to move forward with, we really, our analysis shows that they will provide significant increases in efficiency and improve service reliability and on-time performance for families. There is really synergy between these various recommendations, and so when implemented together, they are stronger than each of the recommendations taken individually. And so I think that that's important to understand. I think also important to understand are a couple things. One of which is what we're also trying to do with our holistic set of recommendations, beyond just looking at specific design levers or specific optimization problems and so on. What we're really also doing is we looked at staff capacity and we looked at process and we looked at technology, was to help the transportation department move forward and orient themselves differently and operate a little bit differently, more in a manner of continuous improvement. And that's something from our experience, from my own with Boston Public Schools and from working with districts around the country, that it's necessary for transportation departments to function in this way, more so now than ever, as the work has become more complex, it's more dynamic, the needs of our families are more complex as well, and costs have gone up. And so there's more technology and more tools, however, that can be used to facilitate, more complex logistical systems, but we really need to operate in a different way. And so that's part of what this is designed to do too, is to set us on a foot of continuous improvement and a trajectory of continuous improvement. And part of that is just getting families and your school communities oriented around these conversations, just that things need to be more adaptive in general as we move forward, so that we can continue to create equitable access and provide reliable service for students that need it and that need that access. So finally, just to point out that these 12 recommendations, most of which could be implemented in varying degrees of depth and intensity. Right now, the district has chosen 5, which I agree with and I think is a strategic approach to start with. But all of them could be, again, in this mode of continuous improvement. There's opportunities to continue to drive forward along the lines of these recommendations and pursue new ones in the long term in combination with other efforts to maintain, but also to continue to enhance efficiency, to enhance sustainability, and to continue to improve system performance over time. So I think an example of this is we talked about an opt-out strategy, and one option would have been to pursue, for example, an opt-in strategy, which it carries more risk, but also could potentially achieve more benefits. So I think starting with a very strategic and targeted opt-out strategy, as the district is pursuing, is a wise way to start. But that there be maybe more opportunities along those lines as you go forward to continue to glean benefits from these recommendations and this plan in a mode of continuous improvement, in partnership with the various stakeholders and with your community.
Thank you so much. That concludes our presentation, and we look forward to taking questions.
Thank you. And before we start the questions, we definitely appreciate the expertise, the formative. We really do. And tonight, we were just trying to get quickly to the point of the concerns that were out in the community. I believe you've addressed them all. And as soon as you give us those talking points, that will help us as well.
Yes, ma'am.
To speak with one voice around this issue. Okay, so now I see 2 lights, and board members, the administration has asked that you give the questions to them, and they'll give what they need to give to formative. That's what I understand.
Yes, ma'am.
We are doing the 2.5. Okay, thank you. So we have board member Boozer-Struthers.
Okay, thank you so much, and thank you, Dr. Coleman, Director Baldwin, and Formative. One thing I'm wondering if we could say this in another way to be really clear, because there is still confusion, especially, there's more walkers than bus riders in some of our districts, like mine, especially for the elementary schools. So a lot of this is a lot of change. They're like, that it's like, why is it, this is impacting us, but we don't really have buses anyway, so why are we moving from 7:45 to 7:30? And the statement, the data is 33% have no change. So is another way to say that is that right now, 33% of our schools already started 7:30, 8:30, or 9:30. Is that an accurate way to say that? Because this is where some of the confusion is happening for our 745 elementary schools that don't really have bus service.
So I'm going to turn it to Director Baldwin in just a moment, but in some cases, the majority of students do not have bus service. However, there are still some situations where we do have to provide transportation for a small subset of children, and that impacts the overall whole. One of the other pieces to keep in mind, and we discussed this earlier with formative, and Director Baldwin, you may want to speak to that as well, is that the bell times that we are proposing for adjustment don't take into account the non-public schools that will not have aligned bell times with us. And so there's built-in inefficiencies with those non-public schools that we have to work around. And so we are addressing the variables that we can through these alignments, knowing that we're going to lose some efficiency in those other areas.
Correct. And just to piggyback what Dr. Coleman has said, because he hit it right on the nail here. We want to streamline services, and I want to be in a position to be able to support all of the programs on all of our students. And so we want a situation where I have enough of a supply to meet your demand. And that first goes with standardizing the three-tier system and ensuring that we have adequate time, travel time, between each tier, despite whatever time. So even with some of our walking schools that we found, we still have buses that come because they may have sped students there as well. So again, we want to paint a general picture that we're able to support all of our schools with those asks for transportation.
Thank you so much. And can we come back on the second round?
Okay.
What's wrong?
The question wasn't answered. Okay. I mean, every walkable school will be 7:30, 8:30, or 9:30.
So
Is that correct?
What I don't want to do is say that now, because we're looking comprehensively where all of our schools, the vast majority of our schools, have some level of bus service. And so we are in the process of vetting the bell time scenarios for all of our buildings to determine what the most optimal outcome can be within the parameters that we've set around 90%, and then the 10% that's shifting. And so what we are asking is for patience from the community, allow us that time to complete that vetting process, look at the optimization models, and then provide a comprehensive response on April 25th at the board meeting.
Thank you. So we're going to move to, so what I understood from that, just to summarize to make sure your question is answered, on April 25th, after their optimization process, then you'll have every school outlined. And so we'll be able to tell right away. Your answer will be done.
Yeah.
You'll know if it's 7:30 or 7:45.
That's correct.
Right? Okay.
By April 25th.
Yeah. Let's just, is that okay?
That's
for
really
right now?
new information. That 7:45 is still an option.
No, he didn't say it was an option. I'm just saying your question was around 7:45. So the three times were 7:30, like, they told us 7:30, 8:30, and 9:30, and they're in an optimization phase now. So it sounds like they can't answer your question to the 25th. Or come back the second round.
I appreciate it.
Oh, absolutely, absolutely. Come back the second round. Board Member Briggs is up next, and immediately following will be Dr. Z. Miller.
Yeah, I just want to say thank you for the thoughtful presentation. Thank you for the time you took to put this together with the consultants at Formative. I think just, I guess, a piece of feedback would be more so the case, because I know that these rollouts are, they just have many factors to them, many parts, many segments, and so it's not going to be perfect. And I think the biggest piece that I got from the community was that they were unclear around the 7:30, the 8:30, the 9:30. And I wonder if that partnership with the comms team could be, a section around frequently asked questions. When you did the focus groups, were there things where parents were like, what does this mean, and can those things be posted? I think the details that may be left out, like we're still trying to figure out, those last details could be asterisks at the end of the website, right? In small print, just things that we could do. Because I think the biggest piece of feedback that we're getting is that parents and community members are trying to plan their schedules for next year, their work lives, when time their kid's going to get out of school. If their time is being pushed up for elementary, then will they have to have aftercare programs? And all those things are just creating anxieties. So I think in hindsight now, if we can have a more kind of better partnership with comms, I think that would just help to, not to say that it wasn't, but, some of those missing pieces.
Definitely
So,
appreciate that feedback, and we'll keep it in mind, and that's something that we are actively working with to ensure that our comms and operations team are completely on the same page, and that we're putting out the information that people need to know in a timely manner.
Yeah. And then I did just have one last question about the after-school care. Is there going to be anything happening? I don't think that's going to be transportation, but for families that may have their children getting out of school earlier, is there going to be some way to support families that may need additional care for their children?
So one of the things I will say is currently all of the schools that have our vendor managed care, those schools will remain. We've already begun those communications with those schools where we're waiting for this list to tell them we don't know which one yet, but if any of the schools that they're currently in, would they be able to support adjustments? So we've already started those conversations. For schools that currently do not have managed care, we would have to go through a full process to bring on any new school. That means potentially vetting, doing an RFP, bringing on more vendors, going through that process, and going through licensing. And so if a need arises, we can look at that. But for our current schools with vendor managed care, they should be okay.
Thank you.
Thank you. Our next question is from Board Member Zipporah Miller.
Good evening, thank you. And I don't want to belabor the 7:30, 8:30, 9:30, but I do want to say thank you for taking such an aggressive approach to really try to resolve this transportation issue. One of the challenges, or should I say concerns, that I've been getting from my constituents on a regular basis is about the clarity around that. But I think Board Member Briggs asked the question. I want to follow up with that and say another one would be about the April 26th date. So this comes from the high school level where they're saying we need to register. We don't know whether we can do half-day schedule or dual enrollment because we don't know whether we will be one of the schools impacted with the major change, Bowie High School, because they're now an early school, and if they were the ones to go to 9:30, so that's the panic around scheduling. And some communication with the counselors, because I'm not sure if they need to be in communication with the colleges regarding dual enrollment, so that's one of the concerns that is coming up. So that's the first question about the April 26th. The second question has to do with communications. Thank you for sending out the flyer. I'm wondering, with this flyer going out, I certainly will continue sending out also to my constituents via different avenues, but could it be sent out by district, like the ones so that they can pay attention? You can easily gloss over the list, but can District 5 get theirs? And so they know we're coming April 18th, and District 1 know they get coming. Is it possible to do that so that they can, they're able to just hone in on when theirs is?
That is possible, and also for the toolkits that we're providing next week, we are personalizing them for each district member as well.
What I will say about scheduling is our schools will have enough time to schedule. In terms of dual enrollment, we currently have Academy of Health Science. That is a school that starts after 9 p.m. And they have dual enrollment for all of their sophomores, juniors, and seniors, and some of their freshmen. So dual enrollment with our community college partners should not be a problem, regardless of start time.
And just specifically to Bowie High School, there wouldn't be, we did not propose a scenario that would move Bowie High School to a 9:30, because they currently start at 7:45, so the maximum that any school would shift would be 60 minutes.
Thank you for that, because I think the panic was because when the information went out, the clarity around the angst, will we be one of the schools? And of course, because you're waiting to really look at it, I didn't want to answer yay or nay.
Yes, ma'am.
Yeah.
Thank you. Our next question is from Board Member Adam Stafford.
Thank you. And, I again thank you for your swift action on this. As one of the board members that have been advocating for this for some time, I think we are certainly moving in the right direction. I think just taking a step back, I think one thing that we are coming to terms with this year, and I hope that this administration is feeling from the PGCPS community, is that our stakeholders are seeking a design with instead of a design for approach to systemic change. And quite frankly, a lot of this change really didn't land with, particularly, I'll just say for myself, for my community, because of some of the communication challenges and feeling that stakeholders were not involved in the decision-making, especially receiving this information over break. I think that was very challenging. I had folks messaging me on Easter. They were very distraught about these changes. And so, when we have these sort of lapses in communication and this confusion, it really erodes our community's trust in the school system. So many people saying, well, I have to leave the school system, I have to go. And we want to retain as many people as we possibly can. And so, considering that amount of backlash that was received and just confusion, I would have liked to have the formative team here, in person to talk with us. It was difficult to hear the presentation, and considering that this is we are a major school system, this was a major shift, it would have been nice for them to be here in person, or hopefully they're coming on the 25th. But, I'm wondering if you could just share just a little bit more about the way stakeholders were incorporated in the decision making. So for example, who were the 3 scenarios presented to? Were they presented to the same groups that were part of the formative for initial data gathering groups? That's one question. And my next question is just around if we're increasing the walk times and we're increasing the amount of walkers, considering, how are we considering, expanding our support for safe passages, especially with students walking through neighborhoods that, may be unsafe, maybe don't have sidewalks. I think this is a recurring question that we're coming to, and I think a lot of parents are concerned about as well.
Thank you so much for that question. So before I turn it over to Formative to speak to the community input process, I did just want to answer the first and the last question. The first one, Formative certainly has been very responsive to our requests around the implementation plan. They have every intention to be here in person for the April 25th meeting, and I believe I shared that at the March 21st board meeting. This was an emergency add to the agenda, and they're out of state. And so they weren't able to make it here on short notice for this meeting, but certainly they are prepared to participate in some of the upcoming community information sessions. They're going to be participating in our OBAFA meeting, and they're going to be at the April board meeting. So they're connected with us. With respect to the safe passage piece, when we conduct, and this is our approach to the process, when we conduct the bus stop consolidation or walk zone audits that are going to take place, if we are not able to determine safe passage for students to school, then the bus service will remain. And so I want to make sure that we assure people of that. The safety of our children will always come first. And if we have to provide a bus or continue to maintain that bus in order to ensure that, then that will be done based on the criteria that has been established for assessing bus stops. And now I'll turn it to Formative to speak to the community input process around the priorities from our community.
And I just want to be clear, we're very clear that they held stakeholder sessions to develop the recommendations. I think we're very clear on that. When we say that there were scenarios that were developed, like we could have 7:30, 8:30, 9:30, or you could give these different options to the community, who were those scenarios presented to? Were those presented to the same stakeholder groups? Because that's where I think the disconnect is with the community, that the recommendations happened, then the decision came, and now we are presenting these to our communities, but we're after the recommendation.
Sure. So to be clear, the subject matter experts are here. Director Baldwin, myself, the team, along with the input from Formative. And so our process has been to gather the data, the operational data, the instructional impacts, the community stakeholder piece, and then have to formulate a decision that's going to solve it. We are dealing with, well, let me let Formative speak to that, and then I'll come back to you to provide a little more context.
Yeah, I can speak to there was the broad array of engagements that I presented early on and summarized. That was, conversations with numerous folks from staff across the district, within the department and outside the department, with parents, with students, and others. And I think the scope of that engagement was, broadly speaking, information gathering for the purposes of the audit. And it was broad in its nature, including, but not limited to, discussion of various options that, at that time we were evaluating and then ultimately became part of our recommendation. So understanding the various trade-offs and risks and benefits as they perceived them with respect to if bell times were to change, or versus if, students were asked to walk further to bus stops, for example. So then, with those recommendations and then, or with those, having had those conversations, having done the analysis that we did, then presented back to the district with the audit and the opportunity analysis, one of the key findings, which was that we thought that there was significant imbalance within the bell times, and that there were opportunities to make changes to bell times which ranged from more significant to much less significant, but that which all of which had still created significant opportunities to create more efficiencies, create more reliable service, improve on-time performance. But that ultimately the actual changes in the actual schools that would change, and the process therefore, we needed to rely on the district's team in order to, help us figure out what the other various qualitative factors and so on, which might lean towards moving, proposing to move one school versus another, which schools, for example, the non-district schools that weren't able to move, although we presented some scenarios, idealized scenarios, where if we could move them, that would enhance efficiency further, but we understood that we weren't, that would be much less feasible to be able to do. So I think that's where then, we helped district staff come up with various options where, knowing how many trips, where the imbalances were and how many trips needed to move and how many trips each school had, and then helping them work through some of the, again, various impacts of scenarios that then they developed, and helping them understand then to come up with what their ultimate recommendations were. That was the extent then of our work, and what we've been continuing to do as part of implementation is, okay, what if we did this, what if we did this, and this school moved here, this school moved here, and then we could evaluate what the various impacts would be.
Thank you. The other piece that I just would like to add is that knowing the pace of change, because change is a very challenging process to undergo, especially with a district of our size, is that we have selected to implement these prioritized recommendations in a very modest way. And that is because we don't want to outpace and leave our community behind with respect to feeling like they haven't been heard or their input hasn't been considered. And so when we look at 90% of our bell time shifting either not at all or by 15 minutes or less, that felt like a responsible change, especially given the demand for improvements in transportation. We didn't think that would be universally objectionable to shift by 15 minutes at the, for the vast majority or none at all. And so how much input do we need to shift 15 minutes was kind of the thinking. And so when we consider the walk to stop, if you go deeper into the report, the walk to stop average is 0.24 miles currently. If you look at it, the real median is 0.17. So the vast majority of our students walk even less, and there's a small subset that happens to walk a much longer distance that pulls the rate up to 0.24. And so we have, over time, gotten to a space that it just isn't manageable. We've heard from the beginning of this year how ineffective we've been with transportation, and so we are committed to fixing it responsibly. Like, that's the community input we've received more than anything else. Fix transportation.
Yep, you're right.
And so now here we are with a modest set of recommendations, 15 minutes or none at all of a change for 90%. A walk-to-stop increase that still is less than a half mile, an opt-out and not an opt-in. We are taking the most tepid steps we can to get to the improvements that our community has been pounding the table for. And so what we need, what we are requesting, is the patience and the grace to do the work. We have 85,000 students, and this will be the last thing I say. I know you.
Yeah, you have 5 board members waiting.
Okay, then let me pause. I'll pause.
Okay. Board member Rout.
Thank you so much for this is great. It's just, as a parent, I have the parent seat on the board. It's really hard to hear the explanation of our parents being an afterthought. We only change in the times 15 minutes, but parents should be a partner. And that is what I feel as the parent on this, as in my seat. I represent all parents in Prince George's County. And this school year, us parents have all been an afterthought. Administration have made decisions that affect parents and the young people, and we communicate it to parents, and parents, they digest it. They may write a board member, they may write the superintendent, but they keep on going. And I think this big of a jolt to our system, we understand transportation, I said early on, is a grown man problem. It is almost grown. It's 17 years old if we look at all of the studies. So I applaud this administration for taking its time to really hire subject matter experts, but we did not think about handling our community with care. And board members have stated that time and time again this school year. And so as a parent who has a child that's in a early development program as well as a high school and all in between, it's not fair. It's not fair to just think it's only 15 minutes and not have a really comprehensive plan to educate the parents on why this is such a great decision. We skipped that step. And we skipped it with other opportunities that I've shared with you, Superintendent, in writing. We can do better for our parents, and we should have acknowledged that the information that we put out was wrong on multiple occasions. It wasn't until after the fact that it came through. So I'm speaking up for our parents, and our parents also want me to tell you, the Stop Finder app don't want it, they don't want it, it don't work, they don't want it, they don't want it. They have told us time and time again, and I understand all the things that you all have said with the tablets work, and if this is turned on, and we all are operational. Parents have emailed all of us. They don't want it. Are we trying to save money, or are we trying to improve our transportation system? I yield back.
Thank you. Vice Chair Walker? Yeah, she made a statement. Yeah, okay.
Okay, thank you so much. And thank you for the clarity that you have listed today. One request that I have for consideration for Mr. House and team, you don't have to answer tonight, but is it possible, would you consider moving out the transportation meetings until after the 25th? And the reason why I say that is because I just am concerned that the real questions that they want to know are, how will this impact my student? What will be the plan if the moving really does impact my student by an hour or by 15, 20, whatever the minutes are? And do we prioritize, what does it look like for elementary schools? I just think those are the questions, and if we don't have the list of schools, we might just put ourselves at a disadvantage So that's one. Hold on, you can wait till you're 2.5 minutes. Let me just squeeze them all out. Okay, so that's one. The second piece, so that's just moving out any opportunity that we might have to shifting it until the 25th when we have further data for the community meetings. The second is, I just want to make sure our pages are cut off a little bit. So it goes, we don't get the end of this amazing sheet right here, and then it goes 1, 2, 3 on page 1 to number 8 and 9. So if we're missing anything, if we could just have that, you don't have to go into it now, but at least mine does, and I know Boots or Struthers does. Okay, so no worries. If you could just take a look at that, and it might be, okay, just the numbers might be off. Thank you so much. The next piece is the Stop Finder app. If we can do assuming that you're moving forward, because you said that there are a number of different additives in that app that we haven't necessarily leveraged yet, that you want to leverage in the future. Thank you so much. No, I think yours is the same as mine. Yeah, yours is the same as mine, but thank you, Mr. House. Yeah. I was hoping that we could have, maybe you all have this, but maybe there could be just a focus group that plays with it. So you have just, even if it's the board members that have students, like let's just leverage us, maybe PCAC, a small group, to just flesh out any inconsistencies with the Stop Finder app. That'll be important, huh?
Tell the how, come on.
Oh, yeah, I can't tell the how, but just consideration, you know. I know I'm working on that, guys. The next piece that I have is, do I understand, if I'm reading this correctly, that, I only put half a sentence. Okay, I'll come back. Dang. Oh, it's about safe passage. I'll ask it on the second round. Thank you. Yes, safe
Okay,
passage.
thank you. Board Member Harris.
Good evening, everyone. Thank you for acknowledging me, Chair. My questions more so come from the assessment side, so bear with me a bit. I know you said we might need to get back to formative with questions. So starting off for the bell time shifts, it reads variables being used to finalize the bell time shifts. Can you talk to me a bit about who is weighing these variables? There's 4 listed out there. I'd like to know who is responsible. My assumption is it's the SMEs, or sorry, the SMEs that you mentioned earlier, Dr. Coleman. I would assume that. From there, I'd like to know if you could talk to me a bit about methodology. You mentioned several times optimization methods. You mentioned some other strategic methods that you're using, but is it qualitative? Is it quantitative? Is it semi-qualitative? Is it vulnerability-based? Is it threat-based? When it comes to your methodologies for your decision matrix, are you using a Pew matrix? Are you using Eisenhower and AHP? Like, you know, talk to me about specifics around that. And then further, lastly, the optimization model, is it an integer model? Is it an integer model, or is it, I assume it's not linear because this is a linear situation. So I want to know some of those thoughts that went into it, because again, I know we said we use focus groups for the actual recommendation portion, but when it comes to implementation, what layer are we activating through that? Are we activating it through the models in partnership with the SMEs? Then finally, for Dr. White, is there an expedited process in place to resolve the concerns around aftercare services? I know we mentioned that if certain schools don't have them, we could do procurement process and all that to get them there, but wouldn't we need to expedite that process for it to match up with the shifting in bell times?
So for vendor managed care, schools that already have vendor managed care, that will be taken care of.
Right.
Schools that currently do not have vendor managed care, we would not even be starting that process. We'd never get through it. When we first started vendor managed care, for some of our schools, last year, after 3 years, we finally, based on state regs, got schools. Like, we can have schools, children in their schools all day long, but when it comes to vendor managed care and getting through the licensure process, it's a whole other thing. But those schools who currently have vendor managed care will remain. We can look strategically to see if any of those schools have openings, you know, if that's a possibility. But I'll take it back to my team. We can at least start the process to see if some of the vendor managed care that we have are willing to open new sites and look at starting that process if there are schools that are interested in going through that process. I just say that, I like to say that to parents, that day one, it would not be ready though.
And thank you so much for that question. So from before I turn it over to formative and to Director Baldwin to talk about the vetting process a little more specifically, just to set the stage, from an operational perspective, balancing bell times is a very complex math problem, quite frankly. We are looking at approximately 85,000 students, which puts us in the top 10 in ridership across the entire country. So we're talking about a very complex system. We are actually looking at balancing our bell times, and that takes into account many variables such as the number of schools, the number of trips per school, the number of bus lots, the number of staff positioned at each bus lot to balance the demand on each specific tier. And so we're working with both formative as well as with the TransFinder team, as well as our own internal team to complete that optimization of balancing and to determine how those variables need to fit together in order to optimize our plan for greatest efficiency. I'll turn it over to Director Baldwin and/or formative to kind of speak to that a little more specifically.
I'm going to defer to formative.
Carl, we're going to let you all go ahead and talk a little bit more about the process undertaken to vet the scenario as far as the balancing.
Sure, the technical methodology?
Yes, sir.
Sure. So, yeah, we employ a number of different methods as part of our process. You know, as we've mentioned, this was a far-reaching, multifaceted analysis, and it has quantitative and qualitative portions, right? The qualitative piece mostly helping us to understand, you know, trade-offs and risks and other kinds of costs and impacts of potential changes so that we can understand, you know, not just based on the numbers of, you know, moving this number of trips one way or this number of trips this way might create some kind of, you know, optimal situation or fewer buses being used, but either may not be feasible or, again, may impact students in some disproportionate way that makes it seem more costly than some other option. But just from the standpoint of the quantitative methodologies used to understand bell time balance and how many vehicles are required to serve, you know, systems under different configurations, we have a tool that we use that we've developed that's our own tool where we can input the various trips and numbers of schools at different bell times to assess the alignment and the balance and the spacing, and then we analyze that against your current routes, the number of trips per school, the length of those trips and the geographies that they're covering, the vehicles covering the trips, and the number of trip pairings each vehicle currently has. And so then we're able to simulate within our tool moving groups of schools or individual routes any amount of time that we wish, or from one tier to another, in order to then estimate what number of pairings, you know, might be possible, what additional time might be allowed for buses to fill up more, and therefore allowing for consolidation of bus routes within a given bell tier. And then also just there's our you know, best practice knowledge and experiential knowledge of when you've got, you know, how much slack is advisable, for example, to allow between bell tiers if there's 60 minutes between bell tiers that a route needs to run. If the route is scheduled to run 60 minutes in between those bell tiers, it's likely that normal variability is going to result in that route being late quite often. And so an understanding that we want not just to fit things together optimally, but also to provide slack to allow for a better chance of on-time performance. So there's a probabilistic component to how we assess what a better or, you know, what optimal kinds of scenarios exist. So that's with respect to bell times. When it comes to the walk zone analysis, for example, that was a completely different way of analyzing what the district's stated policies are, what the walk zone boundaries are as codified in your routing system, and then what a walkout using a set of business rules would produce using Google Maps and other QGIS, other mapping tools that we use in order to produce a list of students that, just based on a cold quantitative analysis of, you know, streets and walking distance, are within the policy stated walk zone for the district. Now, our recommendations then are not to, this is then when the qualitative information comes into play, our recommendations are never to simply take these students and transfer them off the bus to become walkers. No, we understand that now is when we hand our analyses and recommendations to the transportation team with the local on-the-ground knowledge, directionally to give them an area to focus. So we'll say, look, here's a school with a large number of students, for example, that perhaps, ought to walk, and this warrants review, right? And so it helps to give them a prioritized list of schools to review, then for, looking at it closely to understand impacts of safety and various neighborhood factors and barriers that they may have already built within their system, or just knowledge of local streets and crossings and all that very deep contextual geographical knowledge that the local team has, and about their particular students and particular communities. So that's kind of how that part works. The stop consolidation exercise is another example of it's a wholly different set of methodologies we employ to optimize, looking at the set of existing stops. I think that's key. Also, we don't propose new stops. We know that's very fraught and a risky endeavor that really requires in-depth local on-the-ground knowledge. So we did our analysis, understanding that your existing stops have been vetted by your local team, and many of them have been there for years. And so we looked to see if, similar to the walkout analysis that we did for the walk zones, is there a plausible walk path according to our mapping system for a student to get to some other existing stop within the policy criteria that the district already has, and then analyzed what those theoretical new walk distances would be. But now, as part of supporting implementation and in partnership with TransFinder and your team, what that analysis has done is provided, again, a directional list of stops to review.
Thank you, Carl. Carl, I'm going to pause you right there, because we have about 2.5 minutes to respond to each of these questions, so we'll be able to go deeper in the next round. Thank you.
Thank you. Board Member LaSalle Frazier.
Thank you. So when do we consult with parents, our scholars, our teachers, and our staff? The answer is always. We need to consult with them. They are our voice. They are the ones that are accessing our services. So when we fail to do that, we're silencing our community. So I agree with you. Some of my questions, we talked about doing assessments to, how often are we going to redo the assessments? We do have a large transient community. Our parents move from one side of the county to another. So I'm just wondering, when are we redoing our assessment, because it's an ongoing issue. The other part is, can you clarify for me the opt-in and opt-out process? I'm not sure about if I understand that. And then, were bus drivers consulted in this process? I know that they have come here often and talked about that they're experts. So were they part of this process as well? Those are my biggest questions. Thank you.
Thank you so much. So I believe Formative spoke to the fact that this is an ongoing improvement process to include the assessment of our bus stops. So I'll let Director Baldwin speak to that ongoing process that we will be undergoing on a yearly basis to assess our bus stops and ensure that we remain in an optimal place. Because as you said, there is transience. Clarifying the opt-in, opt-out. Opt-in is the more aggressive of the two approaches when you consider it against an opt-out. Opt-in means we wipe the slate clean. No one has transportation as a default, and you have to take an active step as a parent to receive transportation. You have to do something, sign up, in order to receive transportation. The opt-out is the opposite. You are guaranteed as a default transportation service, and we ask those families that know that they won't need that service, those who qualify based on the criteria, let us know if you don't need a bus. So it's a very different approach. The former is much more aggressive. The latter is a lot less aggressive. And I'll ask Formative after Director Baldwin to speak to the bus driver consultation, because that absolutely was a part of the process.
In terms of the assessment plans, this is something that we will be doing on an annual basis with auditing our stops and looking at areas within our walk zone, considering for safe passage from that. And we're going to use a reference information from the National Highway Traffic Association. So it gives us a good reference on creating stops and provides an exception for placing stops if needed. So that will be an ongoing task of our team. Right now, we're looking at close to 20,000 plus stops that we have, and we are phasing them out in order to thoroughly assess them for the start of the school year.
And if I could ask Formative to speak to the bus driver input question.
I can try and answer this one. Is my audio clear?
Much clearer,
Yes.
thank you.
Great, I'll just stay really close to my microphone. We were able, as part of our structured site visit, to interview a group of drivers in a structured manner. And also part of our visit included observations at multiple bus lots. And we were able to both observe drivers and chat with them and ask them different questions, as we also gathered documents and took photographs to understand just descriptively what processes were like at the yard, since that can have just a huge impact on some of the numbers that you might see around on-time arrivals and things of that nature.
Other examples I would just add would be part of those observations, walking the lot, very actively engaging with select drivers as they were signing in, pre-inspecting their vehicles, using their tablets, helping us to understand some of the challenges that they face that impact things like were mentioned with the bus app for parents and so on. So that was really important to understand their role and their challenges with the technology and the processes and other aspects as well.
And the last thing that I will add is the scenario that Carl talked about, the scenario development, but that it has to be vetted through the local team, because the local team actually understands the nuances of our community. Director Baldwin is doing an excellent job of taking the information from Formative and or TransFinder and actually working with the bus lot supervisors, the foreman, and the assistant foreman to actually ask them, is this right? Will this work? What feedback do you have? And those are drivers, and those teams are giving us on-the-ground feedback as we work to optimize the process. But that's also what takes time.
And that same type of engagement has been done with other engagement groups as well. Most recently, this week, as a matter of fact, opportunity with our principal advisory group. I think Dr. Coleman mentioned earlier PCAC and others, but principal advisory group was a part of that engagement, and we spent a good hour and a half hearing feedback around exactly what it is that they saw as positives, as pluses and deltas. So all of that information has been a part of some of the decision making and pivoting that we made over the course of time.
Okay, good. You ready for me to move on? Okay. We will go to our second round. We will start with Board Member Boozer Strother.
All right, thank you so much, Chair. I will try to be quick. I think the difference here is that when we did the boundary changes, you knew the change that your family was going to adjust to from the very start. So you don't know the bell time change from the very start. So I think that's a really big difference. I have been quoted over and over as the rip off the Band-Aid board member, so my position has been clear on bell schedules needing to change, and I think the moving quickly, I think, is important. We've been through, some of us, our children have learned in 3 different environments. If we were in, all of us in distance learning, and then swing space, if you're a part of school construction, and now boundaries. We are very resilient, and at the end of the day, way more parents are still angry about on-time transportation than anything else. And so moving forward will be met positively. But the one thing I'm going to throw a wrench in this is hearing everyone tonight, should we wait on the 6 sessions that are scheduled before April 26th? Should we just wait? Just wait and have all 9 sessions after every single school bell time is known? And then have the session where, if we're, say, in District 3, multiple school communities, that they could ask specific questions and relay specific information about potential challenges. I'm just throwing that out there, given that we may go through those first 6 before that April 26th, and then just end up with more stress and questions. But I do want to acknowledge the email questions I've received and sent in. I've heard them answered tonight. I'm hearing the loop, and I want to acknowledge that. But maybe these sessions will be just better if we wait. And I know we've marketed the dates, but I'm putting it out. I'm just going to put it out there. And then the other request I have, and this is just a bigger thing, is that now that we've created an opt-out for transportation, for parent transportation, we now have, for the first time, actually have a parent transportation system named. We never named it because it just happened. It was independent. The school system didn't have to manage it. But in some ways, we are now saying that we have some ownership of this. And I will tell you that in some of these high-traffic schools that should have never had any cars approaching, that where we have all the walkers, but we have all the drivers now over, which we all acknowledge the safe passages issues that we need to reverse, that if we're going to name it, can we have some rules of engagement around it to help our principals around this? Thank you.
Do you want the administration to respond?
I'm not exactly sure I'm clear on that last point.
Well, let me give you an example.
Thank you.
And sorry I'm taking up time, but an example would be one of the schools in my district had to have a parent meeting because it was getting so dangerous. We had too many parents in a almost 100% walkable school community driving, which was making it almost impossible for safe walking, and it still does today. It's one of the schools we have so many maps and marketing on. The principal at the time asked if he could employ any management around that you can't drive unless you physically are not able to walk your child, or if you live within a certain distance that you could walk within minutes, that you didn't have permission to drive. That is how bad it is every single day at some of these schools built right into the neighborhoods. So that's what I mean by, if we are going to name it and own it, is there more management once we allow it to be created? Because it is a significant part of safe passages.
Thank you so much. I definitely understand the question now and
Okay.
appreciate
But
that.
I don't want to, I think I'm probably just I think I'm just doing my advocacy thing of, like, I'm seeing an issue that I think we need to address.
Well, 2 things, if I could just provide just a brief response to part of it, because that is an important component. As a part of the upcoming budget, we did request to add additional staff, safety officers, to our safety portion of our Safety and Security Services office to help to help with those types of assessments, making recommendations, and helping to support schools with that safe passage component. So we're acknowledging that in the upcoming budget. And then second, I know that Director Baldwin's spoken to this several times in our meetings, that we also want to use this as an opportunity to collect data around what the needs are of our community with respect to making them more walkable. We've heard some of our board members also speak to that as well. So, because that data can then be used to advocate to our county government for the investments in infrastructure that may be needed.
Thank you so much. Board Member Adam Staff.
Thank you so much. And again, I just want to say I'm very excited about where this is going, and I'm very happy to see or to hear some of the explanations that we've heard this evening. With that being said, I think a lot of the confusion that we're experiencing could be resolved through having a more detailed plan that board members and community members can rely on to really track and understand the changes that are happening. one of the things we've consistently heard throughout all of our training this year is that board members are really the voice of the community and that we are liaisons. It's hard for us to really support the work that the school system is doing when we find out critical information like this alongside the public. We can be your advocates, we can be your champions, but including us in this work and having us as partners, I think is really something that's critical. And so I wanted to move that the administration provide us with a detailed implementation plan just on recommendation 1, and that it includes information on stakeholder input. Again, we've had a lot of discussion tonight about sort of what we're seeing as the lack of stakeholder input and just the complexity of just this first recommendation. I mean, we're hearing that my colleagues want to move our community sessions. You know, we're interested in, hearing more information about, yes.
If you've made a motion,
Oh,
so
okay, I
we
was
need
just
to
explaining it.
deal with the motion. So,
Second.
can you restate your motion, please?
Okay. They want me to restate the motion. So
Yeah.
Okay, I move
Okay.
that the administration provide us with a detailed implementation plan just on recommendation 1, and that will highlight and focus on stakeholder input. And I just want to just state, I believe it was seconded, under our board policy, the board can ask for detailed
Excuse me,
plans.
you've made the motion, so now it has been seconded. So we will, is there any discussion from board members? Oh, wait a minute, I have to capture these people that are on for the rest of the session.
Okay.
And
Yeah,
I think I have them, so now we
Point
need
of
to do.
information, I just wanted to hear, for the purpose of my vote, I wanted to hear what else the board member had to say during her time, because she was saying something. I want to be able to vote.
I just need to state the motion so we can start the discussion, and then all board members have an opportunity.
Point of order.
Yes.
We don't typically do motions during work sessions, and I thought our parliamentarian told us last work session that we don't do that because the public doesn't know we're taking action, and so when it's discussion, there aren't actions. So parliamentarian, can you please be clear about that?
Okay, before he speaks, when I put it on the agenda, I put it on the agenda for discussion and action. But go ahead, sir. Talking to your mic and turn it on. Thanks.
Okay, it was put on the agenda as a discussion item, and the rules or the bylaws of the board say that if a discussion item results in a motion, it can be adopted finally or immediately, in this case by a vote of 10, 2/3, or if it's adopted by 8, it will become first reader.
Can you please restate that?
The bylaws say if a discussion item turns into a motion, someone's making a motion, then it can be adopted, as in what they call final adoption, by a 2/3 vote. Or if it gets just a majority, it will become first reader under new business, which means then you have to read it again at another meeting.
I think what we need clarity on is that at any meeting, a board member can make a motion. It's just how many votes it takes for that motion to pass. Or become a first reader. Correct. Okay? So we're good. So let's move forward with, the motion is, the administration provide the board with a detailed implementation plan on recommendation 1. And
The maker gets first choice.
so we will hear from the maker of the motion.
Yes, so I just wanted information from my colleagues on Board Policy 0101. It says that the Board of Education can direct the CEO to develop action plans with clear accountability metrics, and that's what we're asking for. That's what the community is asking for. And I feel based on what we've heard this evening and some of the challenges that we faced with this rollout, having that type of clarity and transparency is necessary at this time. Thank you.
Is there, board members, anyone else? Yes, we're in discussion. Yes, I don't see any lights, though. Okay, so the first light is Board Member Z. Miller.
Thank you. From discussion, but this was a question, it may be related to the motion around the bus times. As you look at the systemic change was the biggest lever. And that's what I understand, that if we change the bus times, then it will begin to solve the problem. So we hear you when you say, give us grace. We know that this is not the end-all be-all, but this is the beginning to try to address the problem. So one of the things I was going to ask, and it piggybacks on what Vice Chair Walker and also Board Member Boozer-Struthers said, was surrounding the communication to our during those sessions for next week. Superintendent House, my understanding was that was going to be an information session and they could give some of their thoughts and their input. So then my question is, that's the goal, do we still continue with them? If the goal was to say, here's what we have and we're moving forward, then they will be asking for more sessions once they're given, this is the start time on the 26th. Then I see the necessity of us considering, should we move those sessions till after we've made the dates?
Okay, we're speaking to the motion now. The motion is on the superintendent bringing us a plan on recommendation one, which is bell time shifts.
So wait for this question till later. No worries.
Right, okay, that's fine. So next we have Board Member Vice Chair Walker.
When this motion was brought up last month, I voted against it, and so I want to just be clear on the ask of this implementation plan, because what I see are some months inside of these timelines with some overall, I just want to be clear on what exactly is the request. Is it this Gantt chart with their detailed operational plan that you want them to provide, or what exactly is it? So I can just be clear on how I'm going to vote.
Sure. I mean, just as I mentioned, having some accountability metrics. So what are the goals that we have here around start times? You know, what are the goals that we have around number of trip assignments? Who is responsible for what? I mean, what I'm assessing from what happened over break is that there was a communication breakdown. What was presented to the public is different from what Dr. Coleman shared with us tonight. He shared with us a very easy to understand plan that was not communicated to the public. To me, that is where we have had two groups sharing information. There seems to be a misalignment. That's just what my takeaway is from that.
I understand.
And so what I'm asking for is just a more detailed plan, because it's such a complex issue with so many different groups, and I don't really see from this broader plan that we've been presented with is where there is stakeholder input after the decision has been made. And so that's what I'm asking for.
Vice Chair Walker?
Yeah, absolutely. Thank you so much for that. I am still under the firm belief that this operational plan cannot be micromanaged by the board, but I do expect accountability for us to be able to share with our communities. I do expect, like Mr. Coleman said today, the breakdown of the 7:30, 8:30, and 9:30. I just think that whatever this plan is, because I'm good to not vote for details to be provided to the plan. But what I do need to make sure that we have is accountability and understanding, and that we won't have communication that goes out that's different than what we've been told here and in the public space. So here, I see a timeline. It's very generic of the timeline, but I'm okay not to vote on having detail because I don't think that's our role. But what you're hearing right now is the disconnect, the frustration, and the parental input that we're getting as board members, and we're just not able to answer it. So that's what you hear right now. And what happens when you have a lack of information is either you start making your own, or you're asking for the people that own it to now start providing us with the exact details. Right? Make sense?
Thank you.
Thank you.
Board Member Rout?
Thank you so much. So I sit here, I am in favor of an operational plan. I wasn't at the last board meeting because I was home visiting my mother. Home is Los Angeles. And my mother is very, very, very sick. Very sick. So please continue to pray for her. But this is not why I'm talking. I'm talking because I don't think there's any harm with sharing an operational plan, because that shows the public that we are being transparent, that we can understand how that we are moving to document our short and our long-term goals. I mean, project plans are normal where we're looking at operations. Our superintendent used to be over operations in many other school districts. I'm just not understanding why the board should not be, or there's no support in understanding and giving oversight. We allowed for no oversight to take place through a motion. And then we had this. There were people, I'm standing in line at Disneyland, I'm getting calls from lots of community members all over, and I'm like, I don't even know, that's spring break, happy spring break, I don't even know what's happening, and so I do think that an operational plan that documents the key objectives and the goals and how we're reaching them. I heard my colleagues share about stakeholder engagement. That is something that we missed. Strategically, we missed with the rollout of this. I know that our superintendent and his staff hasn't. This looks to me, when I'm looking at contracts, federal contracts, this looks like an implementation chart on how we will be implementing our strategies, our outreach, our timelines. This is something different than what I'm used to seeing when we're rolling out a really huge thing. So when we're looking at change, if we look at Cotter's change management model, if you look at Cotter and what he says, how you have to create education in order for let people know, are we doing that? Are we mirroring the short-term goals and then bumping them up to what we can expect overall? I think we have the elements of all of this, but it needs to be outlined. And as a board member, I would really like to have oversight of the school system by requesting this document. I will be supporting this motion, and thank you so much, Carly, for asking for this at our last meeting.
Thank you. Board Member Boozer-Strother.
Thank you. I don't have any more to add than what Vice Chair Walker has stated.
Okay, thank you. Board Member Briggs.
Thank you, Madam Chair. And I definitely think this is a good idea. I want to say that one consideration that I have, and this is to my colleague, Board Member Adam Stafford, is just, I think maybe if we can get more explicit around the language so that there's no redundancies, that we're not taking the time of those that are working on this really important plan away from getting that done. So that's the one piece that I'm a bit concerned about, is just adding it. I don't think it's going to be an extra layer, so maybe it's my misunderstanding. So can you clarify more, like what specifically you're requesting that's different from the initial Gantt chart?
Different from this chart that we're seeing right here?
Or different from the request for the Gantt chart? Because how could those two be aligned?
He had a chart.
I mean, if someone wants to add in a substitute motion that they develop a very specific Gantt chart, they could. I'm trying to broaden it to try to gain more support, for oversight. I don't know why this is such a tough thing for us to discuss, and I mean, it would be different if we're saying that you have to allow us to, monitor every single step of the implementation and that we have to sign off on it. That's overreach. We're asking for an overview. We're asking for a more detailed plan. So for example, I would ask for, number one, what are the goals? What are the metrics that you're going to use to know that you've reached this goal? When are you going to include stakeholder input in said goal? When is the deadline? When is the due date? March through June is a very long window. Like, as we can see here, there is a component of communication that no one knows when that's going to happen. Like right now, board members are saying move it after the 26th. However, it's currently scheduled for a specific window. This is where confusion is going to happen. And so my suggestion here is that they can organize this however they'd like to. And I know some of my colleagues have, far more experience than I do in understanding the different types of ways this could be presented, but I do defer to the leadership here to present us with a more detailed plan so that we can be informed and support in the implementation of this work in the community. And
Got
so
it.
that's all I'm asking.
And is the big objective more public facing? I just wanted to get that piece. Is that the?
You know, initially, when we asked for this in OBAFA, it was that it would be a transparent, public-facing document, and I think that if it was public-facing, you would have a lot more buy-in from community
Time.
members.
Board Member Harris? Board Member Harris? Board Member Harris?
Yeah, I'd like to put in reference to what you were just saying, Mr. Briggs, if I put a substitute motion on the floor for the administration to provide, again, this is similar to the motion last week, or not the last time, for a Gantt chart with stakeholder engagement milestones. That again is a tool or item that should already exist throughout this implementation for you all's view of how these things happen, right? All we want to do is know when these things will happen, plus or minus dates for the duration of the windows for when it can happen, and then you add in your stakeholder milestones for at this point, it's like a triggering effect almost. So when we get to this point, we'll do stakeholder engagement for this reason, X, Y, Z. And like I said last time, I assume that a Gantt chart of some sort already exists, or at least the bare bones of it should exist.
Go ahead.
That's it.
Oh, okay.
I'd like to make a motion.
Oh, you're making a motion.
Make a substitute motion. A substitute motion for a Gantt chart with stakeholder engagement milestones.
Excuse me, you can make an amendment to the motion if the maker accepts it. No?
Sure, amendment.
Okay. You can make an amendment to the motion.
Okay, I'd like to make an amendment to the motion.
Second, Jocelyn Rowe.
What is your amendment? Oh, is there a second? Jocelyn seconded. Okay, then what is your motion? Your amendment.
Gantt chart with stakeholder engagement milestones.
The main motion is for the administration. Right, so now he's doing an amendment to the motion. So he's changing the words for the first motion. Do you understand that? And I'm asking Board Member Adam Stafford. You understand that?
Yes, I accept it.
Okay. So, what's the motion? Yeah, so I need to write it down.
Oh, yeah, so the amendment to the motion is a Gantt chart for the administration to produce a Gantt chart with stakeholder engagement milestones.
Produce a Gantt chart for what? With
stakeholder engagement milestones.
With stakeholder engagement milestones. Okay.
Or I guess inclusive of.
So, excuse me. So, the motion as amended, the motion is for the administration to prepare a detailed implementation plan, and on recommendation 1, which is the bell times, and prepare a Gantt chart with stakeholder engagement milestones. Do you understand that, board members? Because, okay, the motion on the floor is the administration will prepare a detailed implementation plan on recommendation 1, which is the bell times, and prepare a Gantt chart with stakeholder milestones. stakeholder milestones. Well, that would be substituting her plan. Well, you can debate it when we have the discussion, right? You can debate the amendment when we have the discussion. The motion is?
The motion still includes what the original maker made with the addition.
With the addition, correct. Because he amended.
You can get in line for discussion. She has a discussion list.
Right.
Yeah, for discussion.
Okay, so it has been moved and seconded that the administration will prepare a detailed implementation plan on recommendation 1, which is the bail time shifts, and prepare a Gantt chart with stakeholder engagement milestones. Okay?
Yeah, point of information.
So at this time, we're debating the amendment.
No, mine was, that's why I said substitute to begin with.
Oh, you said substitute?
Yeah.
Because that's what we were talking about. So you really want to substitute your motion for hers?
That's right.
Shayla, pull back your motion.
A substitute is a form of amendment, and it would permit the assembly to debate and amend the original motion to suit their needs, followed by debating and amending the substitute to suit their needs, and then voting on whether to make the exchange, and then voting on the result.
Okay, that makes sense.
Is that okay? I mean, is that clear?
It makes sense to me.
So at this time, we are having a discussion on the motion.
Okay. I like to accept the substitution. I think we should vote on that. The substitute is that they produce a Gantt chart with stakeholder input milestones. I'm okay with that. I accept that as a substitute for my motion, and I think we should vote on it.
Okay, so do you want to withdraw your motion and just go with his motion of the Gantt chart?
I don't think we need to withdraw mine. I think we should vote on his, and then if it passes, then we go with it, and if it fails, then we go back to the original motion.
Okay. So, do you want to withdraw your motion? Because you can make it again if his motion fails.
Sure, that's fine, if that will expedite things.
That does. Okay, so now we're voting on having the administration prepare a Gantt chart with stakeholder milestones.
One correction, inclusive of stakeholder milestones. Inclusive of stakeholder milestones.
Inclusive of stakeholder milestones. Okay, got it. Okay, the motion is have the administration prepare a Gantt chart with a Gantt chart inclusive of stakeholder milestones. And it has been seconded. And now we're ready for discussion. And I need to turn all of these lights out. I have the names. Okay, we'll turn it on first again. Okay, got it. You got it. Dr. Juanita Miller. Oh, Harris, because he made the motion. I have to go to the person that made the motion first. Thank you. Dr. Harris. You have first discussion option.
No, thank you.
Okay, then we'll go to Dr. Juanita Miller.
Madam Chair, my question is in reference to what the parliamentarian shared with you and you shared with us, that it will take a 2/3 vote for this to go through. Am I correct?
It will be settled if we get the 2/3 vote. If we get 8 votes, it's a first reader.
Okay, thank you.
Okay, we good? Okay.
It would take us past the next meeting.
Could you
Anyway,
please
it's not
help me?
Sorry.
All right, Dr. Z. Miller? You don't? Okay. You do it? Okay, Dr. Board Member LaSalle Frazier, is your light? Good, it's a light.
I don't have a question. I basically think that the more transparency we have with our community, the better. That's it.
Thank you. Vice Chair Walker?
Yes, thank you. I don't want anyone to hear that this is not a lack of us wanting, or me, let me just talk for me not wanting to have oversight as it was insinuated today or said today. This transportation is not ours to own. It belongs to the operations. In my estimation, this is a make or break for our administration, our system, our scholars. Transportation has got to be fixed. And I believe that we are on the road to that. So when I hear things like a Gantt chart with dates, and I want to know when and where and how, I think that is what I oftentimes do, jump into the how, that I'm trying to work backwards on. But what I will say time and time again is that we've got to get ourselves to a place where we are being transparent, but we're also being very clear and trustworthy that you all are going to produce exactly what you say. And what I've heard tonight, I've heard that this month of April, you're already meeting with stakeholders. This is what I believe that I've heard. You have a plan. I see a general timeline for a plan. I see that there's going to be community meetings. There's been no shift to the ask. I just asked. There's been no shift to it. They're scheduled. I see those things happening. So for me, I see this, I'm not going to prepare myself to then dissect a plan because I have an operations background, and I know that that's exactly what myself and others will do when we get this plan. So I'm going to leave this to the operations, knowing, trusting, and believing that you have an implementation plan that will be executed and that you should share with us. I don't believe that we need to make a motion in order to dictate to you of what you need to be able to provide for clarity and to lack the chaos that's happening inside of our district. We recognize that you all gave us information last month. After that communication went out, wrongly so, there's chaos. And what people are trying to do is ensure that the communication plan is clear and it's out, and we can be supporters of you as we move forward. I will not vote to micromanage that, but I will tell you clearly that I am looking for you all to do what you say and make sure that this is executed effectively. And that means that month by month, the milestones that you have, that you will actually do those, you will report on those every single time we have a meeting, and let us know where we are and if we're green, yellow, or red in relation to the plan that you already have. So I just wanted to state my expectations. If they're a little bit too much, then I'll vote on a motion, but I'm inclined not to because I don't want to micromanage. I don't think it's ours to own. Thank you.
Thank you. Dr. Zipporah Miller.
Vice Chair Walker, I think you took some of the words out of my mouth. So I have been grappling with this because I believe that part of the hiccup was communication. So, you know, in terms of how we ensure that the public and our constituents understand where are we and what are we doing at this point. And another piece was, when do we get to give input or our feedback or our, you know, input to the plan as we learn about the plan. And as I look at the action plan that you presented and then what you presented today, I don't think it'll, well, I believe that much of the information that we're asking was clarified with here, but I think what we still need to know is communication. So, you know, as I sit here, I'm grappling with the Gantt chart, and I did tell my colleague, because I don't want to be in a position where we distinctly have been in workshops where we've really talked about what is the role of the board and what is the role of the superintendent. And the superintendent is operations, and I definitively don't want to step into the role of the superintendent and as his team. But I do want to ensure that we are clear to our community members and to our constituents regarding transportation, because this is something that's really been a huge hiccup when it comes to them at the beginning of the school year. I want to ensure that when the school year starts, that they clearly understand where we are, they clearly understand what the bell times shift how it will impact them, and then have clear expectations that this is a part of fixing the problem, so that we're not giving them expectation that at the beginning of the year, everything will be fixed. So I want to consider an amendment to the motion, but I don't want to, I don't have the words to figure it out, because I don't want us to be in a position where we are interfering with the operations. We are supposed to provide oversight, and I want to be sure that that's where we are, but I also want to make sure that we are in the space where we are also giving our community members clear information, so that they're clear on what is going on from day to day when it comes to transportation.
Thank you. Dr. Harris?
Thank you. So I'll make it quick. Throughout project life cycles, or when you think of project management, respectfully, I'd say that a Gantt chart could be seen as a tangible deliverable, right? Like, I'm not asking for a Gantt chart and then to make action based on the Gantt chart. What I'm looking for is a view-only document, and based on that view-only document, I'm looking for when our community is going to be heard, quote unquote, throughout this process. Again, this tool of a Gantt chart or anything similar is something that already exists throughout the implementation process of your project lifecycle. So all I'm asking for in the amendment is to have access to view that. Again, it's not to take an action on it, it's just to view it from my perspective. Thank you.
Thank you. Board Member Rao.
Thank you so much, Chair Mickens-Murray. And I think that, just in hearing a lot of my colleagues' oversight, I just question then why do we have committees to work through issues such as operations if we are not afforded the opportunity to provide oversight by requesting a plan. No one is asking for approval to move forward. Board members are simply asking for a plan. There's an African proverb I want to bring to everyone's attention. If you want to go fast, go alone. If you want to go far, go together. And what I feel that my colleague, Board Member Adam Stafford, who's also the chair of the OBAFA committee, and the vice chair, Dr. Harris, this is an actionable thing that the OBAFA committee has been working towards. Really looking at plans, bringing that information back to the community, because we have been jumping up and down in OBAFA. We want to be partners. And this was another example. In my correspondence to the superintendent, this was the 5th example of my assessment as a board member, fairly new board member, but there were engagement opportunities that were missed. And this is just a simple way. I'm really looking at why don't we just operate in good faith and say, you know what, we can give that to you. What is I don't understand what the big deal is about providing a plan. It's a plan. Plans can change. Thank you so much.
Thank you. Board Member Boozer Struthers.
Thank you so much. I mean, I just don't want it to get lost that we have a significant communications plan for stakeholder engagement that was provided to us this evening and by email that covers many of the most critical points, and this will be very soon in the spring, in April and May, around the bell time changes, if your bus stop is changing, if you no longer will have a bus stop, that there'll be significant communications training for the principals on all the issues. There will be postcards, letters to prepare for the coming school year. So I think these broad strokes of what's to come has been presented to the board. So I didn't want that to get lost, that there is not a stakeholder engagement plan. But as I've stated, my agreements with some of the points that Vice Chair Walker has made around our role. Thank you.
Madam Chair,
Thank you.
right here.
Where am I
Madam
at?
Chair,
Okay.
if once board members have completed the round, I just want to make a comment. That's okay.
Yeah.
I just want to make a comment once board members have completed their round, if that's okay.
Okay, let me go to Board Member Adam Stafford.
Yeah, I mean, I'm hearing a lot of folks talk about accountability. I mean, how would you hold someone accountable if you don't know what the goals are or what the metrics are or what you're looking for? I mean, I don't see any of that in what we've been presented with. And that's part of what our charge is. Our charge is oversight, and our charge is to be a liaison to the community. The community is clearly speaking to us, saying that there have not been enough opportunities for stakeholder input, and there has not been clear communication. It just, for me, I think I've been on the board here for about 4 years now, and I think that there's a tendency for people to, sort of forget that we are here to serve the public, right? We do not work for PGCPS. And so our job is to say things that are often uncomfortable, but that's because we represent tens of thousands of people who have different opinions. And so when we're asking for oversight, that's not saying you can have oversight and you can still trust someone. That those things can be mutually exclusive. We're not saying that because we want oversight, we don't trust you. If that's what your view of being a board member is, that's problematic, right? Because our role here is to provide oversight so that we can be better liaisons to the community. And so that's all I have to say here. I think we should move to just go ahead, call the roll. Let's just get this going. I mean, if you support oversight and going through this process of asking for a plan, so be it. But let's get going.
I have to vote, right? She called for the vote, but is there a second? Who seconded? She seconded? I know, but she called for the vote. Was there a second?
Yes, Jocelyn seconded.
Okay, then we have to vote.
How do you
We have to do the roll call.
Ending discussion, and we get.
I understand that, but the rules of,
We have to vote on ending discussion. I went round 2, and I have a light on for round 2. Discussion's been ended. We get to vote to end discussion or not.
She does.
finish the cycle for round 2 or round 1? All of it? Okay, there were 2 lights on, not 3. There were 2 lights on. So it was Board Member Boozer
Point of
Struthers and Board Member
information,
Briggs.
Madam Chair, I
Yes.
think I heard a motion, and I think I do recall seconding the motion that was on the floor. Per the training that we received, that there's a motion on the floor that we must carry through. So I heard us being able to call the roll. Was that what you said, Board Member Adam Stafford? Yes, and I did second that. So are we able to?
But we had 2 lights. I need to finish
Oh,
those
on
2
this one?
lights on this
Oh.
one.
Point of information, I think you have to end discussion, and then you can call the roll.
I need to recognize the 2 speakers, and one was Board Member Briggs and then Board Member Boozer Struther. Yes, Board Member Briggs.
I just wanted to say that I think what I heard, and I think something that feels to be true for all of the board members in the room, was that we had an outcry from the community about miscommunications, and I think just a degree of anxiety and stress. And so for me, I appreciate the motion, because I think that based on what we shared this evening, we, are advocating for some form of continuous communication to our public. But I also want to see if there's a way where we can, I hear different stances, and I think that there's that other piece around us, not being more governing, but we're not a part of the day-to-day operations. But I do think we have a responsibility to the community to, if a process isn't happening, to usher that across the finish line. And so I do feel that this is a really good opportunity for us as a board to think about how we can coalesce behind an idea that may be needed to be a little further fleshed out, but that could be, I think, responsive to what we've heard from our community members. And so I just want to throw, I think that we agree on a lot of points. Perhaps this specific motion isn't it, but I think that we could move forward with some type of a motion that I think works for everyone. That's what I want to say.
Okay, Board Member Boozer-Struthers.
Yeah, thank you. I just feel like this discussion went into another direction about questioning even the metrics of why we are doing this. I mean, number one, this is the issue that has been brought to us over and over again that we are being asked to fix and asking Superintendent House to fix. And I just want to get back to the why, because I feel like there's now a question of why we're doing this. We're doing this, obviously for on-time service, but this is also that learning loss disruption on first period is chronic. It's not just a disruption of the students who arrive on those late buses. They're keeping assistant principals and other important staff members at a door instead of in the building, and that's safety and culture. This is missing breakfast. If they get there so late, they can't spend time to eat the breakfast. We're doing this for our bus drivers' working conditions, and I hope we can invest in our bus drivers with our savings, the redirection of the funds. We're doing this for a much bigger systems issue, and the asking of why we're doing this as if we haven't even thought through that, I feel like has just been questioned, and I just couldn't stay silent on that, so thank you for the time.
Thank you. And Board Member Boozer-Struthers, those were the two that had their lights on prior to the motion that was made and seconded to call for the vote. Roll call on the motion. Ms. Lopez. On the question from... On the...
Madam Chair.
We end the debate, but we're voting on the, we're voting on the first one?
Voting on whether or not to end debate.
Oh, we're voting on whether or not to end debate.
Yes, that's what I thought. We're voting on just whether to end debate,
Okay,
correct?
so, that's fine. So, we're voting on whether or not to end the debate, because that was the motion. So, Ms. Lopez, call the roll, and this motion is on whether or not we're ending the debate.
So what is the motion? Yes, ends debate, no, does not end debate, is that correct?
If you say yes, we continue the debate. If you say no, if you say yes, it ends debate, no, it does not end debate. Okay, Ms. Lopez, call the roll.
Mrs. Adam Stafford?
Yes.
Ms. Boozer-Strother?
Yes.
Mr. Briggs?
Yes.
Dr. Harris?
Yes.
Mrs. Lasalle Fresher?
Yes.
Dr. Juanita Miller? Dr. Zipporah Miller?
No.
Mrs. Rout?
Yes.
Ms. Walker?
Yes.
Mrs. Pickens-Murray?
Yes. So the yeses mean it didn't pass. Thank you. So now we go to the motion on, is there any further discussion? If we just end the discussion, how can there be further discussion? One person, I see one light, and that's Dr. Zipporah Miller. New motion.
I was going to ask Board Member Harris if we have a plan here, and I hear us talking about a plan, and I heard Board Member Briggs saying some kind of, the plan was presented to us, whether he would consider having the motion amended so that they can just add the clarification on the communication plan and when and what will be communicated to stakeholders and parents and community in the plan that was already presented to us. Yes.
That was just a question.
No, it was, I'm asking for an amendment.
Okay, amendment. Are you making an amendment?
Yes, ma'am.
Okay, and what is your amendment?
To revise the plan that's already in place, that we were already given.
No, you can't do that. Wait, she's revising the plan that they presented.
The plan that we already have on hand.
Right.
To include the communication.
Dr. Harris's motion was to have the administration provide a Gantt chart with, that is inclusive of community engagement milestones. Is that what you want to amend?
That's the one that's on the floor right now, correct?
That's the one that's on the floor.
Correct.
So is that what you want to amend?
Yes.
So how?
To
You wanna amend it?
to include clarity on the communication to parents, community, and stakeholders regarding timelines and what will be communicated during those sessions.
But I hear you saying the same thing that his motion already says.
Well, my assumption is his motion is to create a Gantt chart. My amendment is we already have something and just add to the document that already exists.
Okay, but. Oh, you want to add "and," but tell me again, please.
Understanding is the motion is to create a Gantt chart. What I'm asking to amend is we have a plan. What I'm asking is to just add the clarity into the plan that's already presented to us.
Which is separate from what they want to do. Okay, we need you to state specifically the words, because I think, and I'm just paraphrasing here, you want the plan that was presented tonight to have what you want added to that plan, but not to his motion.
So the addition would be, with the plan that's already here, we talked about understanding when we would have the community sessions and the goal of the community sessions. So when are we having community sessions? Are those sessions for input, or are they information sessions? So that the community can have an opportunity to give input and also then learn from what the next steps are.
Okay, hold on, because what I'm going to try to restate this again.
Absolutely.
What I believe you're saying is that the plan that the superintendent provided us tonight, if we would include the community engagement piece, which I thought they had, with what the administration said to us tonight. So I'm just not clear on the addition that you want, but I know that it's not in addition to Dr. Harris's motion, or, well, the previous motion was withdrawn, so, yes.
Communications part, it says like Monday, April 15th, and all of the dates, it gives the schools, and according to the email that went out,
You want Harris to include this plan. I think that's what she's asking, Dr. Harris, is that you add the plan that was presented tonight with additional, that you add the plan that was presented tonight instead of the Gantt plan, instead of a Gantt chart.
But we're still not clear what the sessions on next week are going to be for. Are they for community input, or are they for to relay that to the
That's a
parents?
different discussion.
So that's
Right.
what we need to know, because the community wants to know when they come to the meeting, is it a meeting for them to ask questions, or is this a meeting where we're being told what is happening?
Okay,
Right?
beg your pardon.
I think that's.
Madam Chair?
We're seeking clarification. Just give me a minute.
Madam Chair, may we make a comment
You know
while?
what? I withdraw my amendment.
Okay, you withdraw your amendment, good. We need to take the vote before, before I recognize you, Chief of Staff. So the vote is on, have the administration prepare a Gantt chart inclusive of community engagement milestones. Is there any discussion? I see Board Member Rout. Board Member Rout.
I was trying to get your attention because I think Chief Boyd wanted to tell us something. She
Yeah,
raised
but
her hand.
I can't recognize her.
Well,
until
that
we
was
finish
what I
the vote.
wanted. That was what I wanted. I
Okay,
wanted
that's
to
what
hear
you
what
want.
she
Yeah,
had
I'm
to say
coming to
because
her.
it may or may not affect the way that I vote.
Yeah, but I need to deal with the vote now because, right, so,
But can this be a part of my time that I allow her to respond to us?
no, because it's not part of the process. It's board members, we've made a motion is on the floor.
This is information that will inform my ability to vote up or down this motion. And I feel strongly that Chief Boyd has a piece of information that would possibly clarify this.
So that we won't need to vote? Is that what you're
Correct.
saying?
That is what I'm
Go ahead,
saying.
Chief Boyd.
Yeah, thank you, Madam Chair. Thank you, Madam Chair. I wanted to share with the board that the information sessions that are to begin next week. Our information sessions, we are going to be collecting feedback, and the community will have an opportunity to ask questions. Chief Patel, would you like to add anything to that?
That's what they say.
That is correct. So it is, the way it is planned, it is that it is available for the Transportation Department to provide the information that we have been sharing so far. It will also be the opportunity for our community members to ask any clarifying questions, any feedback they have, and there will be members of our engagement team there to collect that feedback so we can take it back and take a look at it.
Thank you so much, Chief Patel. So, Madam Chair, I wanted to share what I thought I heard information, that this sounds like this is the stakeholder engagement plan, maybe, a little bit.
That's what I heard.
Combined with some of the other things. So I think that this actually proves my point, is what I'm trying to make. We get these puzzle pieces, and what we are asking for in a Gantt chart is it formulated so that we can be able to understand and see what affects what. How does this affect this? This goes first and this goes second. I mean, this is a normal operation in project management, so I'm just not understanding why there's so much resistance to just asking for a chart that will provide clarity and accountability.
Look, I think the board members are at the point of voting, and that will be their decision. Is there any further discussion? Seeing none, come on, guys. Come on. Ms. Lopez, please call the roll on the motion to have the superintendent prepare a Gantt chart inclusive of community engagement milestones. Hey, please.
Mrs. Adam Stafford?
Aye.
Ms. Boozer Strother?
No.
Mr. Briggs?
Aye.
Dr. Harris?
Aye.
Mrs. LaSalle Frazier?
Aye.
Dr. Juanita Miller? Dr. Sipora Miller?
Abstain.
Mrs. Rout?
Yes.
Ms. Walker?
No.
Mrs. Mickens-Murray?
Aye. 2, 3, 4, 5, 6. It fails. There are 6 ayes, 3 noes, and 1 abstention. So, I have,
Point of information, so that
yes,
motion
you
still
can,
can
you
make my
can, you
original
can go back
motion?
to your original motion, yes, you can. She's gonna make it.
Okay, here we go.
Because she withdrew it.
So
Go
my
ahead.
motion is that if you have the exact language, I'll just go back to the exact language. I move that the administration provide us with a detailed implementation plan just on recommendation 1 and focus on stakeholder input.
It's not about you.
Second, again.
Plan.
Jocelyn Rout.
Focused. And focus. And, you said and focus, Ms. Adams Stafford, board member?
With the focus on stakeholder input, she said.
With a focus on stakeholder input.
Okay, with the focus on stakeholder input. Okay, so the motion, and it's been seconded. Okay, it's been moved and seconded that the administration provide a detailed implementation plan with a focus on stakeholder input.
Recommendation 1 with a focus on stakeholder input.
Okay, administration provide detailed information on recommendation 1, which is the bail changes, with a focus on stakeholder input. Is there any discussion? Oh, we go back to you first, because you made the motion. Board Member Adam Stafford? Because you made the motion, I go to you first. So do you have any additional comments, or are you good? Okay, then we will go to Board Member Rout.
Yes, thank you so much. I just want to take this time during the discussion to say that I'm just as equal of a board member as anyone else sitting up here on this dais. And I will not tolerate any disrespect from anyone trying to hush me or silence me. There has been a lot of history with women and black people being silenced, and I will not be silenced. So I want to be able to vote just like everyone else. I want to be able to have my time just like anyone else. And I want to state that what just happened was very wrong, and I want a public apology. Thank you so much.
Thank you. Seeing no.
No, I do, yep.
Oh, excuse me. Okay. We have Vice Chair Walker.
Yeah, I just have a question to the administration. I think it's more for you, Tedro. Inside of this, I know I have to ask you. Inside of our transportation toolkit, communications toolkit, doesn't it have stakeholder? Maybe I missed it. Doesn't it have stakeholder input inside of it? Can you just? I'm trying to look at it and see what I clicked on earlier. But can you just remind me of where I go for that in the toolkit?
Real fast. Give me 1 second. But in there, it does include language to share with stakeholders.
Speaking to the microphone, please.
Apologies. Thank you. In the toolkits, we do have language that can be shared with stakeholder groups. In our toolkit with principals, we're also going to include messaging around social media, the flyers, email templates that will also include more information on the improvements and next steps as we go through this.
Yeah, I thought I read, for clarity, I thought I read the timing on when stakeholders were going to be consulted is not the right word, talked to, engaged throughout this plan. I thought I read that. Did I make that up?
No. So part of it is that the information sessions are scheduled as of now to start April 15th on Monday. And then we're also going to provide additional information when the schools are impacted by the different school started in times on April 26th.
Okay. Thank you.
Point of information, Chair, if you could just
Excuse me.
recognize what Board Member Rout was referencing. I'm not sure what transpired, but she's asking for an apology, just asking out of professional courtesy.
I don't think there's a role for me to tell any board member to do a public apology. I've not read that in any document. So public, if you see that in a document, send it to me. But I don't think so. That's individual choices. Board Member Zipporah Miller, comments?
It's just so am I hearing that what we're asking for already exists? I just want to be clear on that, because the key was to ensure that we had communication and for them, for our public to be clear when they are being, when the sessions for them to include their input would be held. So am I hearing that that is next week, and that has or has not? We sent out the chart,
sure.
But are they clear on this is a session when we are going to give input?
It's called information.
Excuse me.
That's correct. That has been communicated.
Okay. The only reason I'm asking is because the flyer that I saw, unless there's something that I missed, said just learn what to expect. So as we send, I think, as we send out the ones for the board, because you had indicated that you could send them out, could it just add, I'm just requesting, not trying to get, could we add that this is a session to hear from you? So that they know that this is not, you're not being told, here's the time that we want to hear from you.
Sure.
Are you responding?
Yeah.
You good? He said sure.
If he
You
said
good?
sure, yeah, then I'm good, because I wanted to
Okay.
ensure that if what we're asking for is already existing, do we need a motion?
Okay, I will have a comment later, but right now it's Board Member LaSalle Frazier.
I think that, first of all, I agree with my colleague Sephora Miller on that. If it exists somewhere, it needs to be clear. We've been going back and forth all night about whether we should have the sessions first before the meeting, the next board meeting, or should we wait? Even that, we don't have clarity. So what we need is for communications to provide a very clear and precise language so our community knows what to expect. We need the community to know that this is going to be an input session, not just an information session. So we need to be clear about the language that we're using, because that is what communications is supposed to do.
Thank you. Seeing no more lights, my comment is this. When I read this, ask the administration to give us detailed information with the focus on stakeholder input, I am seeing outcomes of your meetings. In other words, you're doing the meetings. When you come back to the board, tell us what happened in those meetings, who you talked to, that kind of thing. I think we're getting caught up in semantics, but I like the implementation plan that you had tonight. And I thought that was at the higher level that we, board members, really need. And you were more detailed tonight than the last board meeting. I was also making a request that you report out at every meeting from now on through the summer so that parents would be clear. So we're having another meeting on the 25th. You've heard us, I believe. Therefore, I won't support this motion. I believe you've heard us, and I will respect that. So, no more lights, call for the roll. Ms. Lopez, on the motion.
Mrs. Adam Stafford?
Aye.
Ms. Buser Strother?
No.
Mr. Briggs?
Aye.
Dr. Harris?
Aye.
Mrs. LaSalle Frazier? Dr. Juanita Miller? Dr. Sephora Miller?
No.
Mrs. Rout?
I vote yes.
Ms. Walker?
No.
Mrs. Mickens Murray?
No. 1, 2, 3, 4, 5. 5 votes in the affirmative. 1, 2, 3, 4, 5. 5 votes in the negative. Motion fails. Okay. Is there any more discussion about bill times? Mr. Coleman? Dr. Coleman?
No, ma'am, thank you.
Okay. Superintendent House?
No, ma'am.
I have a light from Dr. Sephora Miller.
So I just want to clarify, because with that motion, we said the information exists, and so I just want to clarify, because the first session is going to be on Monday, that they will get some information regarding what the session is about, so they know what to expect. Because if parents know that here's an opportunity to give, we need to be clear, this is an opportunity for us to hear your input. That way they can plan accordingly.
Okay?
Yes.
Thank you. Seeing no more lights, once again, I thank you for the presentation. I thank you for your patience, indulging all of the questions, the motions, all of that. It says to me that you hear us and that you recognize there are concerns out there in the community, because your presentation tonight represented that. So having said that, thank you, Superintendent House and your team. Now we will move on to follow-ups items. Follow-up item sessions will be posted on board docs upon receipt. The board would like to inform the public of the following upcoming meetings. Academic Achievement Committee meeting, April 15th, 2024, 5:30 p.m. Policy and Governance Committee meeting, April 16th, 2024, 5 p.m. Operations, Budget, and Fiscal Affairs Committee meeting, April 17th, 2024, at 5 p.m. The next board meeting will be next Thursday, April 25th, starting at 5 p.m., starting at 5 p.m. Please continue to check the board webpage for updates and more information about the upcoming board meetings. Seeing there is no further business, the time is now 9:38. This meeting is adjourned.